Clerk, do we have quorum? Sergeant at Arms, kindly ring the quorum bell for 10 minutes.
So the prayer has been said and the chair taken. However, there is a quorum hitch at the commencement of the sitting of the House, and the Speaker has directed that the quorum bell be rung for 10 minutes. This is as provided for in the House Standing Order number 40 to be able to give room to the members of the Senate to make their way into the chamber and enable the House attain or raise that much needed quorum for it to be able to commence. Earlier on, I had indicated that two cabinet secretaries have confirmed their availability to attend the invitations to the Senate chambers this morning, being a Wednesday morning, when the Senate hosts cabinet secretaries or members of the executive to be able to respond to various matters, could be relating to county, inter-county, national, regional, or even international concern. And this morning, the Cabinet Secretary for Health, Aden Duale, and the Cabinet Secretary for Interior and National Administration, Kipchumba Murkomen, are set to appear before the Senate chambers. We were looking at some of the questions that the Cabinet Secretary for Health will be responding to. One was from the Senator for Nairobi City County, Honorable Edwin Sifuna, regarding unsettled claims to a student at Naivasha Girls Secondary School who died on 17th of October 2023, that there is a claim that was lodged by the government has not paid the last expense compensation to the father. The Senator for Makueni has a question to the Cabinet Secretary for Health regarding Tobacco Control Fund and also any measures that the ministry has taken to address the current influx of oral whether there are any measures the ministry has put in place to address the current influx of oral nicotine pouches, e-cigarettes, and such other tobacco products among the young people of Kenya, whether there are any steps that the ministry has taken to ensure compliance with the tobacco control regulations, particularly regarding the solatium contribution from tobacco manufacturers and importers, and also following the judgment of the High Court in Constitutional Petition number 143 of 2025. And on the same line regarding that question is that the Senator will want the Cabinet Secretary to also indicate how tobacco control is being coordinated within the ministry and across the other government institutions, particularly in the context of devolution. Now, you will understand that these are the primary questions that the senators ask the cabinet secretaries, and these are questions that are normally forwarded to the ministry prior the appearance before the Senate. And of course, once these primary questions have been responded to, senators also have an opportunity to ask supplementary questions which have to be aligned or in line with these particular primary questions. The Senator for Kisumu County, Professor Tom Ojenda, also has a question for the Cabinet Secretary for Health, and this regards the measures that are in place to ensure that the Social Health Authority, commonly referred to as SHA, processes and settles claims that are submitted by low-tier hospitals in rural areas and small private hospitals promptly, and also with similar priority given to the settlement of claims from national and county referral hospitals. These are questions that the Cabinet Secretary, as he awaits to be ushered into the chamber, will be responding to. If you're just joining us, that the House is about to commence, The prayer has been said and the chair taken. We can see the speaker already and at his chair. However, there is a quorum hitch. The House has not corrected yet. At least 15 senators, as per the House Standing Order number 15, should be in the chamber at the time the prayer is said and the chair taken for the House to be able to be deemed to have corrected and for it to be able to commence. If that is not present, then that quorum bell will be on, at least to give room for the senators or to the senators to be able to join their colleagues in the chambers for the business also to be able to commence. And being a Wednesday morning, it is a day that the Senate is hosting cabinet secretaries, the Cabinet Secretary for Health and the Cabinet Secretary for Interior and National Administration have confirmed their availability. They will be responding to various questions. And once the primary question has been responded to, the senators will have an opportunity to do a follow-up of the similar question or a question that is aligned to that particular primary question. The Cabinet Secretary for Health will also respond to questions from nominated Senator Honorable Catherine Muma. The Senator will be seeking to understand from the Cabinet Secretary the rationale for the 18-year age restriction on access to hearing aids under the Social Health Insurance Assistive Devices Benefit Package. And also when the discriminatory age restriction will be removed so as to allow adults with hearing impairments to access hearing aids under the Social Health Insurance Assistive Devices Benefit Package. The Senator will also want the Cabinet Secretary to indicate what the ministry is doing to address the high cost of hearing aids in Kenya, and whether the Cabinet Secretary could state whether there are plans to procure and distribute hearing aids through the Kenya Medical Supplies Authority, commonly abbreviated as KEMSA, or other government procurement channels to make them affordable. And also if there are any long-term strategies that the ministry has put in place to enhance access to quality health care by persons with hearing impairments, and provide details on government's plan to train and recruit additional audiologists, establish hearing care centers in every county, and integrate ear and hearing care into primary health services to facilitate early screening, among other interventions. This is a question that will be asked by the nominated Senator Honorable Catherine Muma, and this is to the Ministry of Health. All this coming up just shortly once the House commences. The nominated Senator Honorable Hamida Kibwana also has a question to the Cabinet Secretary for Health. This is a question regarding the operationalization of the Kenya Climate Change and Health Strategy across national referral facilities and county health systems. The Senator will be seeking to understand whether there are any measures that have been put in place. The first quorum bell has lapsed. Let's listen into the Speaker on whether the quorum has been attained or not yet.
Order, honorable senators, kindly take your seats. We do have quorum now, so we'll proceed with the day's business. Clerk, you may call the first order, please.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Now, honorable senators, we had 4 questions that are directed to the CS in charge of cooperatives and micro, small, and medium enterprises. However, this morning we received a letter to the fact that the CS is engaged in an official function, and therefore he will not be able to appear before plenary for purposes of responding to those 4 questions. However, we do have an indication that the CS Health and the CS Interior will be able to appear before plenary this morning, and therefore we are going to start with the CS in charge of health, who has 5 questions this morning. Now, you will note that the CS Interior has 11 questions. So we will have 16 questions this morning, meaning time will have to be allocated accordingly. I will ask the clerk to do the math so that I guide you on the time to be expended on each of these questions so that we can cover all the 16 questions. But first, clerk, can you confirm that the CS Health is present? So, honorable senators, we're going to allocate 11 minutes per questions. And honorable CS, I know we have received your written responses to these questions, and therefore you may wish to summarize when you're responding for purposes of saving on time. Now, we're going to start with question number 25. Question number 13 by the Senator for Nairobi City County, Senator Aden, CBS MP. Honorable Senator, you may proceed to ask your question.
Thank you, Honorable Speaker. This is a question to the CS for Health. Why has the government not paid last expense compensation to Mr. Norbert Bolungu, father of the late Ms. Shekaina Pendo Vudavila, a student at Naivasha Girls Secondary School who died on 17th October 2023, despite the claim having been lodged? And the second part, Honorable Speaker, of question number 13, when will the claim be settled? I thank you, Honorable Speaker. Oh, there's a part C, just my apologies. Part C of question 13, could the Cabinet Secretary also state when the rest of the pending claims under the defunct Eduafia medical scheme will be settled once and for all. Thank you, Honorable Speaker.
Honorable CS, you may proceed to respond.
Thank you, Honorable Speaker and Honorable Senators. On question 13, the government acknowledged the lodging of this specific claim following the unfortunate demise of Mrs. Shekina Pendo and Master Robin Murimi Majao. The delay in the compensation, Honorable Speaker, was occasioned by operational transition from the former defined national health insurance to the social health insurance, and the subsequent lapsing of the Idu Afia medical scheme on the 31st of December 2023. So following this operationalization of the Chief Act 2023 passed by this House, all the liabilities had to be transferred to SHA. And this specific claim falls under group life and last expense category of the defined scheme. So the prolonged delay was occasioned as a result of the necessary system checks and verification of these inherited historical liabilities, which established that the total pending group life expenses for Edu Afia stood at Kenya shillings 116 million. On the second question B, when this claim will be settled, Honorable Speaker and Honorable Senators, this claim will be settled within the next 2 weeks, and even to be more specific, by the 8th of May, this claim will be settled, and the House can hold me to that. Because SHA will disperse the entire 116 million to clear all the pending group life and last expense claims under this scheme by 8th of May. And I will write to the Honorable Member and notify, and even the Speaker through the clerk, when that payment is made, which will fully settle Mr. Norbert Bulungu and Mr. Elias Majao's claims. On C, could the Cabinet Secretary state when the rest of the pending claims under Idu Afia medical scheme will be settled once and for all? Honorable Speaker, the total pending claims, specifically for the defined Idu Afia medical scheme, currently stands at 735,822,556. And I have categorized group life and life last expense amounts to 116 million. Inpatient claims is about 320,550,523. Outpatient claims is 299,271,833. And with the 116 million for group life and last expense being settled on or before 8th of May, the balance of 619,822,356 remains for outpatient and inpatient claims. This remaining hospital claims shall systematically be settled against the broader debt of NHIF legacy debt upon the availability of funds. And Honorable Chair, as I promised last time, to accelerate this, because the legacy debts of the former NHIF affects our health facilities, the National Treasury has allocated 4 billion in the recent supplementary budget, and that will cater for people who we owe between 1 shilling to 10 million, accounting for 92% of the total debts of the former NHIF. And I intend, after the ongoing verification, to put the remaining balance of the legacy debts of NHIF in the next financial year, beginning July. So by July, we shall settle all outstanding verified NHIF claims, so that this animal or the elephant in the room of former legacy debts of NHIF is dealt with in totality by July this year. Thank you, Speaker.
Senator for Nairobi City County, do you have any supplementary questions?
Speaker, I am happy that when it comes to part B of the question, the CS has given a specific date. This is the sort of responses we expect in this House. So I will wait for the 8th of May and expect that communication from him. I also note, Honorable Speaker, that he has included the claim on Master Robin Murimi Majao. Mr. Speaker, you remember this is the last time the CS was here was over 6 months ago, and I personally handed him the documents he said he had not received. I am happy that he has acknowledged. But, Speaker, my only concern is with regards to part C of that question. When he uses language that is vague, I wish he was as specific as he has been in part B and A on when these remaining claims will be settled. Even a timetable will be acceptable at this particular point in time, so that we can be able to answer the questions of the people, that at least there is a timetable encompassing a period of 3 months, 6 months, not just saying that they will be systematically settled against the broader NHIF legacy debts. I thank you, Honorable Speaker.
Honorable CS.
Honorable Speaker, Honorable Senators, the last 2 bits are part of, including even the 116, are part of the bigger and wider NHIF legacy debts. And we have separated into 2 categories, 0 to 10 million, accounting for about 5.3 billion. What we have verified as genuine claims was 4 billion by the time the supplementary estimates were being tabled in the House. I'm happy to report that the National Treasury has factored in the 4 billion. So we will start paying that from next week. The other amount which is being verified now, I want to assure the House, because we work through a budget cycle, the National Treasury, we will factor in the next budget, 26-27. And once the House passes in the month of June, July and August, we will pay the 2 other, all outstanding, including the inpatients, the outpatients, and the many, many other claims, surgery, maternity, the many, many other claims, upon verification. So, Honorable Senator, the one for the 8th, please hold me to that. These other balance, hold me to that. By August, there will be no outstanding verified claims of the former NHIF.
Now, we have 3 minutes left to this question. Senator Manzo.
Not on this one.
Senator Matinga.
Thank you very much, Mr. Speaker. Let me start by thanking the CS for the answers that he's given, noting that the SHA still has a lot of issues, especially in pending bills non-paid and not honored. Does the CS plan to conduct civic education on how people should go forward in making their claims in SHA so that they can be able to differentiate when their claims are valid, what they need to do? Because we notice that this is one of the biggest challenges we have on the ground, that people are saying SHA is not working, but mostly because of misinformation. Does the ministry have, or has the ministry budgeted, as in this strategy, a civic education to be conducted so that people understand how to fill in the claim and how and when to claim what amount? Thank you very much, Mr. Speaker.
Senator Newton.
Thank you, Mr. Speaker. My question relates to Edu Afya medical scheme. So could the CS maybe bring us to speed on how pupils and students are now covered after the medical scheme under Edu Afya medical scheme was, done away with, and what benefits, if at all, are the learners entitled to under any such new arrangement? Thank you, Mr. Speaker.
Senator Mungatana.
Thank you, Mr. Speaker. He's our neighbor from Garissa in Tana River, and he has made us proud. But there is one question I want him to clarify, to take this opportunity to clarify. There were many issues about false claims, things that were bordering on criminal conduct by hospitals and doctors and what, and we raised a lot of hell together with the public. I just want him to tell us how many people have been taken to court, how many have been charged, and what is the status. He can use this opportunity to tell us where we are in terms of recovery for some of those crooks who had infiltrated the systems in SHA. I thank you, Mr. Speaker.
Honorable CS, you may now proceed to respond.
Honorable Speaker and honorable members, let me start with the honorable senator from Nyeri. That yes, we're doing a lot of civic education, and civic education is the linking, the missing link in the whole of SHA. But honorable Speaker, if you go to a hospital, and I'm sure that Senator will agree with me, I was in Bungoma, and I went to the maternity wing. And out of 40 women who were in the queue, only one lady was not registered with the SHA. And when we asked her, she said she doesn't have the phone. The only phone they use is the one that belongs to the husband. So Kenyans have registered. As of last night, 30.6 million Kenyans have registered with the Social Health Authority. It's working. This week, from last Friday to going on up to this Friday, we are paying 13.5 billion shillings to all health facilities, from primary health care levels to our referral hospital. And I can even provide the list, totaling to 13 billion. That is the kind of transformation we are talking about. Nyeri County, I really want to thank, is among the counties which is, I think, number 3 in terms of registration. And when I look at even the list, Madari, Nyeri, both the faith-based, the county, and even the private are receiving money. So civic education, we need to do more, but I really want to urge Kenyans who are registered with SHA to download an app called Afya Yangu. Afya Yangu, Speaker, if you download it, it gives you all the information from your nearest hospital, the doctors you require, the amount of money that each benefits or tariffs, and it tells you this is the amount. And if you walk around, even I met a policeman as I was coming to Senate, and he told me I can see my balance on my phone if you download that. So we'll do more civic education. I think our team were in Nyanza. They have finished Nyanza region. Today, the whole team of SHA are in the coast region, and then they will go to Rift Valley, and we are meeting all the players. To Honorable Senator Nyutu of Muranga, yes, Idu Afya First was funded by government, and it has left us with a huge debt because government did not pay during the transition. And that is why the question that the Honorable Senator for Nairobi is asking. But that has been transformed. All our children are covered by and they are dependents of their parents. So once you register with SHA and you pay for SHA, particularly first at the primary health care, it's free. You walk in, you walk out. anybody who walks to a dispensary and health center, Parliament has appropriated the required money. So our children, their parents can walk to any of the health center for outpatient services, free, paid by government. When they come to specialized treatment, the parents covers all their children up to the age of 25. So it's even more better improved cover than the Edu Afya. Honorable Mungatana, yes, the biggest challenge in any health insurance globally, even in the US, is fraud. In fact, in the US it's 28%. The country with the lowest is Estonia, with 6%. But since April last year, when I went to that ministry, it was at 26%. Now I want to confirm to the country, because of the actions we have taken, we are now at below 6%. What have we done? We have closed over 1,200 facilities. The DPP has received over 24 files, of which I think 18 of them, including 2 former CEOs of SHA and NHIF, have been taken to court, and many staff of NHIF, SHA, and even the regulatory bodies like KMPDC who register. As we sit here, the DCI has close to 81 files, of which last week he has submitted 24 more files to the DPP. We will not relent on fraud. We closed, and the senator for Bungoma will agree with me, we closed Bungoma West Hospital. We closed 13. Calvary Hospital in Bungoma, we closed. And let me say it for the avoidance of doubt, so that the senators from those areas can listen to me. We have flagged out 5 counties as the epicenter of fraud. And those counties are Mandera, Kisii, Migori, Homa Bay, and Wajir. And we will not relent on it. And we will not relent on it. And I'm talking of not the county alone. I'm talking of all the facilities. Majority of the fraud is taking place in the private health facilities. But what are we doing? As the senator for Nyeri have asked, we have started to reduce fraud and to reduce rejection. We have rejected claims worth, as of today, 13.2 billion. If we did not reject those claims, in the former NHIF, they could have paid. And we'll keep on rejecting, and it will increase. Because a good example, and I said on the floor of this house, and the good ladies will agree with me, if you claim for a maternity, and your claim for one document called birth notification is missing, that claim is rejected. The only thing that can tell us a child has been born is if you produce a legal document called birth notification. So we're fighting fraud, and I really want the leadership here to help me fight fraud. When I close a hospital, please don't call me. I have seen many people calling me, but I have refused to call. I have refused to budge. On fraud, I will not. And because you cannot steal patients' money meant for the Kenyan patients. If you want to steal, go steal the money meant for roads and water. But somebody who's on a hospital bed, I'm not saying you should even steal for roads, but the more serious, if somebody on a hospital bed, if you steal his money, and that's why even now there's a lot of noise, because I am protecting teachers' money. Because some facilities are used to stealing from teachers. And I'm meeting the teacher union leaders. I'm telling them the only thing I'm doing, I'm protecting your benefits. Thank you, Mr. Speaker.
We'll now proceed to question number 014 by the Senator for Makueni County, the Honorable Daniel Maanzo.
Thank you, Mr. Speaker. Question number 014. A, could the Cabinet Secretary provide a breakdown of the management and utilization of the Tobacco Control Fund, specifically outlining how funds have been received and allocated as stipulated by Section 7 of the Tobacco Control Act of 2007? B, what measures are in place to ensure transparency and accountability in administration of tobacco control fund? And C, how is the ministry addressing the current influx of oral nicotine pouches, e-cigarettes, and such other tobacco products, amongst the youth and children? D, what steps has the ministry taken to ensure compliance of the tobacco control regulations, particularly regarding the solatium contribution from tobacco manufacturers and importers, following the judgment of the High Court in Constitutional Petition number 143 of 2025? And E, how is tobacco control being coordinated within the ministry and across the county institutions, particularly in the context of devolution? I thank you, Mr. Speaker.
Honorable CS, you may now respond.
Honorable Speaker and Honorable Senators, let me just make a confession that since I became the Minister for Health, one of the hardest things I'm yet to crack to the end is this tobacco business. And I really want to thank Senator Muma because she has brought a bill to this House. I really want to thank her. It's going to address a lot of the issues that I met, and now it's in the National Assembly. I pray that they will not amend the provisions the Senate has passed, because the cartels in this industry will do whatever it takes that what the Senate has passed is undone. But to come into the question, the Tobacco Fund is established under Section 7 of the Tobacco Control Act of CAP 242, and it's financed through various sources, and I think I don't want to go into the sources. The member, Honorable Manzo, has it. Maybe just to add that the solatium compensatory contribution payable by licensed cigarette manufacturers or importers in the country may be determined by the board. That's one of the biggest funds. Honorable Speaker and Senators, the primary operational source of the revenue remains the solatium compensatory contribution, which supports the implementation of tobacco control programs countrywide. I have given the breakdown of the financial performance of the fund since 2022-2023 financial year up to 2025-2026 financial year. I have given the breakdown. In 2023-2024, the allocation that was received was 756 million. In 2024-2025, 831 million. And in 2025-2026, 872,550 million. Then on the other side is where we have the expenditure amount utilized. The utilization part of it, I have enumerated year by year. Part of it is public awareness, communication campaigns, the national tobacco cessation programs. We do screening, we do brief interventions, we do referral of patients for treatment, what we call SBRT initiatives. We do review of the tobacco regulatory framework in accordance with the global standard. And we do develop and review graphic warnings on tobacco products. And of course, training of the enforcement officers, stakeholder coordination, a number of functions. So the interventions really is geared to strengthen, enforce, and do public education efforts. How we have utilized these funds, Honorable Speaker, the implementation of the activities for this financial year is ongoing. There are many activities. There is the county level advocacy and awareness. We are doing construction of cessation and rehabilitation centers in Meru and Nakuru, research on emerging tobacco and nicotine products, drug demand reduction campaign, mainly in the coastal areas, targeting our youth. Honorable Speaker, the Tobacco Control Fund remains a very key instrument in financing Kenya's tobacco control agenda. If it's managed with a clear legal framework that ensures transparency, accountability, and target allocation of public health. Honorable Speaker, I think in a week's time I will table a report of auditor's report done by the National Treasury on how this fund has been used. I think they have just completed this week, and they will brief me because I had to find out what is going on and how a proper audit should be done before an audit of this house is done. So the ministry were very much committed to improving the efficiency, the strengthening of the procurement system, how prudent use of resources, and all this must be in line with the statutory requirements. What measures are we putting in place to ensure there's transparency and accountability in the administration of the Tobacco Control Fund? Honorable Speaker, we have initiated a number of key measures. One of them is the legal and statutory framework, because the fund is established under Section 7 of the Act with clear defined revenue resource and restricted expenditure purpose. We will ensure that funds are used strictly for tobacco control program. 2, we have designated under Section 8 of the fund to be managed by a different designated accounting officer who will be responsible for the financial control, for compliance, and for proper record keeping. Of course, thirdly, we have the public finance compliance. The fund operates within the framework of the PFM Act. So every officer, every PFM officer must adhere to budgeting, reporting, and expenditure controls. An annual audits are undertaken by the Office of the Auditor General, providing independent verification and financial statements and compliance. And as I said, we have just completed an audit by the auditors from the National Treasury on this fund, so that we just get a feel of what is happening, and we will share with the House. Conflict of interest safeguards. The Act prohibits acceptance of funds that may create conflict of interest, particularly from tobacco industry-related entities. And then we have the parliamentary oversight. Exactly what I am doing this afternoon, and I'm sure in our committees, the fund remains subject to parliamentary scrutiny through audit reports and accountability process. Finally, the tobacco control regulations and related policies provide operational guidelines, monitoring, and performance evaluation mechanism. Honorable Speaker, these measures collectively will ensure that we put in place a very strong system of transparency and accountability in the management of the Tobacco Control Fund. And as a ministry, we remain committed to strengthening the implementation and ensuring prudent, efficient, and lawful utilization of all resources in support of public objective. Honorable Speaker, on the question is what is the ministry, or how is the ministry addressing the current influx of oral nicotine pouches, e-cigarettes, and such tobacco products among the youth? Honorable Speaker, we must recognize that the evolving nature of tobacco and nicotine products and associated public health risk, particularly in increasing appeal to the young people. So we are controlling how the package, the graphics should look like. So we are implementing a multi-sectoral approach comprising of legislative, regulatory, enforcement, research, public health intervention, which I have outlined in my answer. What each area, whether it is legislative, how do we strengthen, and that's why I talked about the bill before, the Tobacco Control Amendment Senate bill, was meant to strengthen legal framework under the Tobacco Act. And it seeks to particularly explicitly regulates the electronic nicotine delivery system, including the e-cigarette and the oral nicotine. And this is where, Honorable Speaker, you might find your daughter in the house. You think she is using a lipstick, but that is a drug, something that is being laced with tobacco. So they are using all types of different methods to attract our young people. So that law of the Senator Moma has really dealt with all the legislative loopholes. Then we have how do we protect our minors and restriction of access. We want to make sure that the sale and the distribution of tobacco and nicotine products to minors, including limiting license of retail outlets near education institutions. Then we have the product regulation and pre-licensing control, where we make sure that we do a lot of due diligence before we give an importer or a manufacturer the license. Of course, we have enforcement under the existing legal framework. We do market compliance and licensing control. And above all, we do verification and compliance outcomes. The question D was what steps has the ministry taken to ensure compliance with tobacco control regulations, particularly regarding the solutium contribution from tobacco manufacturers. Honorable Speaker, the ministry remains committed to the rule of law while safeguarding sustainable financing. And in this regard, we have taken the following measures: compliance with the court decision, which the Honorable Member has said. We are implementing the High Court judgment in Constitutional Petition number 143 of 2025 in all the regulatory and administrative actions. 2, we are strengthening our enforcement to ensure that all manufacturers and importers comply with the statutory obligations, including the payment of the solutium contribution. Licensing control, payment of all statutory contribution, we must make sure that they are accounted for, and issuance and renewal of license. Then, of course, we do interagency coordination. Honorable Speaker, we do monitoring and evaluation, verification of all the systems, tracking payments, verifying compliance in collaboration with oversight institutions. How is tobacco control being coordinated with the ministry and across other government institutions, especially in the context of devolution? Honorable Speaker and members, tobacco control in Kenya is implemented through a coordinated multi-sectoral framework under the Tobacco Control Act. And this is in line with the constitutional provision on devolution. So coordination is undertaken as follows. The national government, which is the Ministry of Health, provides the overall policy direction. It provides technical leadership and coordination of tobacco control programs. Then we have the interagency collaboration. The ministry works with relevant government institutions, including the ministries responsible for finance, interior, education, trade, to support the enforcement, the regulation, the taxation, and the public awareness. Then we have the Tobacco Control Board. The Control Board provides the intersectoral coordination and advisory support to ensure harmonized implementation. Then we have our county government role, which is for the implementation of the tobacco control activities, including enforcement of smoke-free laws, health promotion, and cessation services, which we work closely, very well with the county governments. And of course, we do monitoring and evaluation. Honorable Speaker and members, tobacco control is effectively coordinated through a structured national and county framework to ensure policy coherence, efficient implementation under the devolved system of government. Thank you, Mr. Speaker.
Senator Manzo, any supplementary question?
Yes. Mr. Speaker, I would like to ask the Cabinet Secretary, now that this House, the Senate, gave him very good regulations and the graphics last year to control tobacco use, one, how is he also reaching out to Kenyans consuming raw tobacco by their mouth, unprocessed, which could even be more dangerous than the e-cigarettes and what people are suckling like sweets? Finally, we've not seen those regulations in the billboards as we had given him. It's almost a year now. And how is he going to make sure that the accounting happens? He said in a week's time or 2 weeks, could we kind of then maybe give him another date so that he can present the Auditor General's report on this and how the money, 700 million or so, has been used in this regard? I thank you, Mr. Speaker.
Honorable CS, proceed.
Honorable Speaker, I think the Honorable Senator for Makueni is in a better position to get the Auditor General's report. All that we get ourselves is a management letter. We provide all information. The Auditor General reports, is an independent office. It reports to the houses, to Parliament. So I think the Honorable Manzo, you can check through the Auditor General reports. But I agree with you. We must make sure every coin from the Celestial Fund is accounted for. I agree with you, and we had a session, and we have now enough money. Since I went there, I have stopped a lot of activities that were not inconsistent with the use of the fund. So we have, and that's why even up to now I have not constituted the board of the tobacco board, because I need to clean up and then see we get men and women of integrity. On advocacy, I think on raw tobacco, I think advocacy is for all tobacco products, including the raw tobacco. And I think the leaders can also help me that we also don't give raw tobacco to our voters. The way we better give them sugar and tea and unga. But in some places they are given raw tobacco, and he knows, Honorable Manson knows. So let's start from there, that as leaders, you help me in advocacy, because I agree with you, raw tobacco is more dangerous. But all tobacco, all types of tobacco, and tobacco accessories that come with, I think we need to advocate, and we need to make sure Kenyans are sensitized and they are told the effects. But Honorable Speaker, just to add, because tobacco is related to cancer, and I want to use the Solutium Fund mainly to upgrade the infrastructure of cancer facilities in our country. And I have started with making sure that we sign an agreement and pay for, from this fund, the servicing of all the cancer machines, whether it is linear machine, whether they're at our referrals, at our counties, so that at least they are serviced, they don't break down. We don't want to have a queue of our cancer patients, then they are told the machine has broken down. So we have agreed with our county government, particularly in the regional cancer centers, like Garissa, Mombasa, Nakuru, the one now at Jaramogi, Kenyatta National Hospital. We are putting some in Mwai Kibaki. All of them, we want to make sure that this Solstium Fund is used to pay for the service level agreement. Secondly, we also want to use this fund to build rehabilitation centers of drug addicts, government-owned, government-run, so that those of our young people who want to come back and reform, they have got very good facilities. They don't become victims of the private ones, which are run by private businessmen. So, and that's why I said we are doing one in Nakuru and one in Meru now. And I think finally we want to promote alternative livelihood. This will be a bit controversial in the regions where tobacco is grown. The growing of that tobacco, maybe they can grow rice, beans, instead of tobacco. Mainly in Migori, Busia, and Bungoma counties. So thank you, Mr. Speaker.
We now move to question number 025 by the Senator for Kisumu County, the Honorable Senator Tom Ojenda. Senator Hamida, you've been nominated to ask that question on behalf of the Senator for Kisumu.
Thank you, Mr. Speaker. Bwana Waziri, my question is, Senator Ojenda's question is 025. Could the Cabinet Secretary outline the measures in place to ensure that the Social Health Authority, SHA, processes and settles claims submitted by low-tier hospitals in rural areas and small private hospitals promptly, and with similar priority given to the settlement of claims from national and county referral hospitals? Thank you.
Honorable CS, you may proceed to respond.
Mr. Speaker, I just want to correct my earlier statement on this, on the Hansard. The 5 chronic counties, I want to correct it. Migori is not one of it. It's Kisii, Mandera, Wajir, Bungoma, and Homa Bay. That's where we have the biggest fraudsters, and they also constitute where we have closed more facilities. Honorable Speaker, the Social Health Authority has implemented a very robust measure to ensure that there is absolute equity in the processing and settlement of claims, regardless of the facility tier, regardless of the location of that facility, and regardless of the type of facility. Is it faith-based? Is it private? Is it public? Honorable Speaker, I want to say that claims are strictly processed on first in, first out principle. This means claims are paid as they are received from facilities, ensuring that low-tier rural facilities receive the same exact priority as our national referral hospital. So I really want to urge, and we have talked to, through our clinics, facility owners, and we have trained them that how claims are lodged is not how claims were lodged under the manual fraud-invested NHIF. Claims are lodged through a digital system, a digital superhighway. 2, our data confirms, and hospitals have confirmed, this equity function is in practice. And today, the settlement rate across all levels in the country is at 74%. Within the 90 days that this House has allowed us in law. The law says we pay all our claims within 90 days. But we are more proactive. Every 14th day of every month, we pay claims. But our claim level currently at 74%. In fact, Honorable Speaker, I was with the leadership of Tenwek Hospital, and they told me the claims rate in that hospital now is at 80%. Specifically, the settlement rate for level 2 facilities stands at, as a primary health care, stands at 73%. Level 3 facilities stands at 73%. And this is directly comparable to the 72% settlement rate for level 4 and 5. And level 6, our referral hospital, both public, private, and faith-based, is at 74%. To support cash flow for management for our small and rural facilities, the Social Health Authority has implemented a strict 90-day claims payment rule, and if possible, even do the 14th of every month, further, which we have been predictably been dispersing at the 14th of every month. And that's why I said from last Friday to this Friday, we are disbursed, and we have disbursed 13.5 billion shillings. If you look at the collection of NHIF, they used to collect between 3.5 to 3.7. That collection was for 5-6 months. So we know what we are doing and what we are saying. Honorable Speaker and members, at the PHC, we have paid all facilities up to January 2026 And the balance is because of exchequer release. Once we get that exchequer release, we will pay February and March and April. We have received also an additional 6 billion, with 2 billion for maternity services, and the balance 4 billion is for other PhD services. Why am I saying? When we had the summit with the President, the Council of Governors, and the President at the summit in December, we have agreed in principle that there are certain dispensaries and health facilities in far-flung areas that are far from level 4 and 5 hospitals, and still our mothers deliver. That was not factored in the architecture of the Social Health Authority. Now we can serve our mothers in terms of maternity in the rural part of Kenya, and they can deliver at level 2 and level 3. Finally, since the inception of the Primary Health Care Fund, we have paid facilities, and this is something I think Honorable Speaker, senators must hear. This is the transformation of universal health care under President Ruto. Primary health care in our dispensary and health facilities. Close to 8.7 million Kenyans have accessed free health care in all our level 2 and 3, and a total of 19.8 billion has been paid in 18 months. They will walk to a facility, there is a charter, it's walk in, walk out, you see a doctor, you go to the lab, you go to a diagnostics system, you go to the pharmacy, and you go home. In 18 months, 19.8 has been paid. In 18 months, 8.7 million Kenyans from all corners of our country have access. Today, the biggest source of revenue for our county governments is from the health sector. So, Honorable Speaker and members, the transformation undergoing in our country in the health sector under the leadership of President Ruto is real, is working, and Kenyans are appreciating across the country. Thank you.
Senator Hamida, any supplementary question?
No, Mr. Speaker, I don't have.
The Majority Leader.
Thank you, Mr. Speaker. I want to appreciate the Minister, a very hardworking Minister for Health, for taking time to come and respond to issues raised by citizens through their representatives, and also for highlighting some of the challenges we have in the health sector, including, Speaker, I saw some idler on TV on Sunday claiming that we should revert back to the old NHIF system. The reports have been laid bare of the damage he left as chairperson of cabinet subcommittees those days. Mr. Minister, despite the good work you're doing, there's somewhere you have failed. The last time you were here, my good friend Waziri, you promised that you will file the report for the performance of the Social Health Authority in accordance with Section 42 of the SHA Act with Parliament after the lapse of the mandatory 3 months. That report is yet to be tabled in the House. You know, the beauty about that report, Waziri, is that it's the only way Parliament, and you have been leader for majority, and you understand how Parliament works. That's the only way we can appreciate the good work that you're doing when you finally table a report before the House. So my question to the CS Speaker is, when is Parliament going to get that report in accordance to the law that this House passed, which the Minister is very well aware of? Lastly, just a comment. The Minister said when he was in Bungoma, out of 41 women that were in the maternity, 40 had registered with SHA, and there is one who had not registered because she did not have a mobile phone. I know the Minister to be a generous man. I hope he did not leave that lady without buying for her phone. I thank you, Mr. Speaker.
Senator Cherahey.
Thank you, Mr. Speaker. Sir, I want to appreciate the Cabinet Minister. He's one of the hardworking ministers of our time. And if all the hardworking ministers who are doing their job, all the ministers like he's doing, will have an easy ride in 2027. Mr. Speaker, my only concern, I was in Kericho County Referral Hospital, courtesy of your office, Mr. Speaker, and I found that SHA is working. because in level 5 they are paying 3,920 per patient. The only problem, Waziri, is that there are no drugs. SHA is working, but when patients go to look for drugs, it is not within the hospital. So, Minister, when the reason they are saying SHA is not working is because they have to buy drugs outside the hospital. In your intergovernmental engagement with the Council of Governors, what are you doing to ensure that drugs are available in our hospitals? Because including your Garissa governor, even my governor, the Kericho governor, and many governors are not giving drugs. And that is why they are giving fodder to people who oppose SHA, that SHA is not working. But yet drugs are not in hospitals. So what are you doing with the governors? But you are doing a good job and you will go to heaven. I thank you, Mr. Speaker.
Senator Mundigi.
Okay, asante Bwana Spika. Bwana Waziri, pongezi kwa ile kazi umekuwa ukifanya kwa hii wakati umepatiwa hii wizara. Tumeona hilo unatembea mpaka kwa vijiji na pia tumeona vile hata unapigana na watu wengine hata wambunge. Pongezi sana kwa sababu unafanya kazi hii ya rais wa Kenya na sisi pamoja. Pahali kuna shinda. Mambo ya kanza umeguzia, na kanza imekuwa disaster katika nchi yetu ya Kenya. Uko na mipango gani ya hii mambo ya kanza, kwa sababu watu wengi wajui ni pesa ngapi imetengwa kwa mtu mmoja, na pia miaka inayokuja kuna njia unaweza kupandirisha ndio ugonjwa wa kanza hiyo hakuna pesa mtu analipa, kwa sababu kwa watoto, kwa kina mama imekuwa ni shinda katika nchi yetu ya Kenya. Na kwa sababu najua unafanya kazi kama mambo ya bodaboda, vijana wengi walikuwa na shinda, ni sisi tu wachanga, lakini siku hizi unaona mtu akianguka na boda anaenda analipa saa lakini anatipiwa. Kwa hivyo hata hii unaweza kuonyesha watu wa Kenya vile utaweza kusaidia. Asante Bwana Waziri. Pongezi sana.
Senator Abbas.
Thank you, Honorable Speaker. Honorable Speaker, I want to thank the Minister for remaining steadfast and focused on the issue of SHA, because there are so many busybodies that run around saying that SHA is failure. Honorable Speaker, my question is that my county has been mentioned as one of the among the four where the fraud is taking place. So I was asking myself, and I want to ask the Minister, what action has been instituted against those people who have made the fraudsters? Because we are not seeing people going to court. Thank you.
Senator Miraj, you've decided to go into hiding. Honorable CS, you may proceed to respond.
Honorable Speaker and Honorable Senators, let me start with the Honorable Leader. Honorable Leader, I do my work diligently, and on the 9th of April 2026, I made a submission to the Clerk of the Senate of the annual report of the operations of the Social Health Authority. And I have the letter, and because it was very voluminous, Annex 1 was NHIF annual report and statements, Annex 2 was on SHA annual reports and financial statements. Annex 3 was on PHC Fund annual reports and financial statements. Annex 4 was on SHIF annual report and financial statements. Annex 5 was for the CCIF annual report and financial statements. And Annex 6 was on the Public Officers Medical Scheme Fund. And the Honorable Speaker, because it was voluminous, I presented a flash disk with a letter. I have the flash disk here. I have the letter here. Honorable Speaker, I can table this. So I do my work. Yeah, maybe, Honorable Speaker, maybe if you allow me, I have done the reports to the clerk. I have the letter, and I have the flash disk. I can still table this copy, the flash disk and the letter.
Clerk, kindly receive the documents and the deemed tabled.
Secondly, for leader, I want to confirm to the House that all the leaders in this country, both current and former, are members of SHA, including those who are saying SHA is not working. We cover the former president. his mother and his spouse. We cover the former Vice President Mudi Awori, himself and his spouse. We cover former Vice President Kalonzo Musyoka and his spouse. And I'll continue and continue. So SHA is working. We have got a VIP. The whole of Parliament, you pay subscription to SHIF. And when you go to hospital for information, the first charge is SHA. Then we go to the medical scheme of Parliament. So SHA is working. Honorable Speaker, the other question from Honorable Charargei was the KEMSA order. I agree. We have a serious problem in terms of ordering. We have invested in terms of commodity and technology as government in KEMSA. Today, KEMSA order fill rate is 92%. Every 10 products you ask KEMSA, they will provide you with 9. And by the end of this year, it will be 100% fill rate. But we have, the digital health superhighway has picked a very peculiar pattern for the House to know. And I'll just pick 3 counties. The county of Kakamega and Governor Baraza is my witness. We found in the provincial hospital, referral hospital in Kamega, 52,000 patients have gone through the system. They have seen a doctor, they have gone to the lab, they have gone to the theater, but they have not been given drugs. We had the same problem with Nairobi. We see the patients moving, but when it reaches drugs, they don't get drugs. We have seen that with Bomet, and we have agreed, we have talked to the governors. And if you go to some counties, you'll see there are many pharmacies around the hospitals. We've seen the same in every place. And because we have recapitalized KEMSA and streamlined its governance architecture, we want our counties to draw KEMSA. Now our referral hospitals are drawing their products from KEMSA. So I think this is a question that we are working with the Council of Governors, and we want to make sure that, but what we have done in the system is that if you go through the system and you are a chief paid up or a SHA at the primary healthcare level, and you don't get medicine, SHA will not reimburse. It will reimburse everything else, but the bit of medicine, they will not reimburse. That will do 2 things. One, it will deny the facility money, so they will be forced to go and buy drugs and supply. My good senator from Tharaka Nithi, Embu, yes, I agree with you. Cancer is becoming a problem. We get 44,000 new cases every year. We lose between 28 to 29,000 of our citizens to cancer-related deaths. But we have established regional centers in Garissa, Nakuru, and Mombasa. We are increasing the infrastructure in Kenyatta Hospital, MTRH, Jaramogi. Now Kenyatta will have like 4 linear machines. Kenyatta serves close to 150 patients a day. So we have increased also the benefits for oncology in order to reduce the out-of-pocket. You remember the last time the president was addressing both houses, we increased it from, I think, 550,000 to 800. And we'll keep on reviewing it so that we deal with the non-communicable diseases, which are now very common. Cancer screening and reducing the risk factors like smoking, alcohol consumption, changing our sedentary lifestyle, among other things that we want to advise Kenya. Honorable Speaker, the last question was from Honorable Abbas. Honorable Abbas is very unfortunate. I also come from that region where the fraud is very high. I want to confirm to you that the people who are taken to court, majority are from Wajir and Mandera. The people who have did out-of-court settlement and paid SHA are also from that region, among other Kenyans. and the files which are being under investigation from. So we are doing, and we are getting also very good facilities in Wajir and Mandera and Garissa and everywhere. And we want facilities that adhere to the law and treat our patients. What we are dealing with, we don't want crooks and cartels who want to eat and who are used to eating from NHIF to continue the same business of fraud to SHA. SHA, unlike NHIF, is driven technologically. There is patterns. And Honorable Speaker, let me give 3 examples we have picked this week from the system, because I have an opportunity and the Kenyans are watching. We found a patient who has gone to hospital 5 times in one day. The system picked. In the morning he was there, he said he had an ear problem. In the evening, at midday, he said he had a stomach problem. And these patients, so the collusion of fraud is between, some of them are patients, health facilities, and healthcare workers. 22 doctors have been denied access to the SHA and digital health system. Over 40 clinicians have been denied their rights because of fraud. And this will continue. We have found somebody who said his dependents are 375 children. I'm sure Senator Sifuna and myself, where we come from, because I saw Bungoma. Bungoma is leading in terms of children. You know, they told me every month in that hospital alone, 400 children are born, which is very, very good. Even from Earth, I don't think whether there is somebody who has a dependence of 372 children. And that person is from Kwale, and the DCI is investigating. We have found men who claim to have over 50 spouses as dependents. We have found women. I'm sure even Kalwale doesn't have 50. We have found men. We have found men who claim to have over between 50 and 70 spouses as dependents. So what is going on in Kenya in terms of fraud? This is what used to happen in NHIF. But I want to tell them that the transformation that is taking place in our country with the support of this House, because the laws that we are using, the Social Authority, the chief, the regulations were all passed by this House, and of course the budget. Thank you very much.
We now move to question number 031 by Senator Catherine Muma. Senator for Nairobi City County, informed through a letter that you've been nominated to ask that question.
Indeed, Speaker, I have. Speaker, in this conversation, for as long as you hear people saying SHA is working, but there's always going to be a problem, and these questions by Senator Catherine Muma are pointers that there are issues still, and we must keep asking these questions despite all the backpatting that we've seen from some of my colleagues. This is a question by nominated Senator Catherine Muma to the Cabinet Secretary for Health. Number 31A. Honorable Speaker, what is the rationale for the 18-year age restriction in access to hearing aids under the Social Health Insurance Assistive Devices Benefit Package? B, when will the discriminatory age restriction be removed so as to allow adults with hearing impairments to access hearing aids under the SHA Assistive Devices Benefit Package? C, what is the ministry doing to address the high cost of hearing aids in Kenya? And could the Cabinet Secretary state whether there are plans to procure and distribute hearing aids through the Kenya Medical Supplies Authority or other government procurement channels to make them affordable? And lastly, Honorable Speaker, could the Cabinet Secretary outline the long-term strategies in place to enhance access to quality health care by persons with hearing impairments and provide details on government's plans to train and recruit additional audiologists, establish hearing care centers in every county, and integrate ear and hearing care into primary health services to facilitate early screening, among other interventions? Thank you, Honorable Speaker.
Honorable CS, you may respond.
Honorable Speaker, the temporary 18-year age restriction on access to hearing aids is not intended to be exclusionary, but rather serve as an interim core containment measures driven by the current resource constraint within the scheme. I say this because the prioritization of individuals up to 18 years was strictly informed by the critical importance of hearing in speech, cognitive development, and educational attainment during formative years. So it also factors in the long-term socio-economic impact of early intervention, aiming to minimize the clinical outcomes within the limited physical space. On question B, Honorable Speaker and members, this restriction is not permanent. SHA, working with the Ministry of Health, we are currently undertaking a very continuous actuarial assessment to evaluate the affordability alongside resource mobilization and benefits within the scheme. So we are working on a very progressive benefit expansion to include adults, and this will be planned and it will be implemented soon. But this is a function of the expansion of benefits for this age category will be guided by a body that is in law called Benefit Package and Tariff Advisory Panel, which must submit a report by September, which is mandated to review and advise on benefit design, the cost effectiveness, and how do we prioritize. So we have written, SHA ourselves, we have written to, is part of the things we have told the whole set of issues to be reviewed and for them to advise us on benefit design and the cost effectiveness. So this one is with that committee, and I'm sure they will make the right decision for the benefit of Kenyans who are in this category. What are we doing as a ministry to address the high cost of hearing aids? I agree that we recognize the high cost of hearing aids remains a very critical barrier, and it's very, not only in Kenya, in many of our African countries. It has become a barrier. It has become a barrier in terms of access. Hearing aids typically cost between 40,000 to 150,000. With most devices, again, are imported on a very small scale. They are sold through private outlets at prices which are unaffordable to the majority of our citizens. These challenges, Honorable Speaker, again is compounded by the limited audiology services outside the major urban centers. So the people who are suffering more are our Kenyans who are in the rural areas. Then again, as the Senator for Nairobi, on behalf of Senator Muma, has raised, we have a very serious shortage of trained specialists as a country. And we heavily, again, there's a heavy reliance on out-of-pocket payments. So the people at the bottom of the economic ladder suffer. And it also affects the whole concept of universal health coverage. So it brings the issue of inadequate access, particularly in rural counties. This again is further aggravated by the fragmentation taxation. There is an element of tax. While the VAT cap 47 accords preferential treatment to complete hearing, and I remember when I was in the National Assembly, we removed that. But it was not done in a very structured way. Some aspect of it, of these hearing aids have been removed, are still holding some taxes as ordinary parts. So all these costs put together are passed to the user. So we need to address a whole ecosystem, a whole area where we feel ultimately we should reduce the cost. We are working with suppliers and importers and vendors, Honorable Speaker. Good example is, I said last time, we have reduced the cost of breast cancer the drug that is used for breast cancer from 120,000 to about 40,000. We are talking to other big pharma companies. Have an MOU with them because the cost of care, cost of drugs in our country is very high. But we have standardized specification for basic, mid-range, and advanced hearing aids in Kenya, assistive technology specification list, which will be incorporated into the Kenya Essential Medical List, which will allow us, this specification will be used to aggregate the national demand under the Social Health Insurance Fund. So that we see whether leveraging on the economies of scale, we can use KEMSA to go and buy in bulk, pool procurement, and then talk to manufacturers and lower the prices. So it's something that we at the Ministry of Health are tackling, and I'm very happy the Honorable Senator has raised. But through the 80 Scale Initiative, which we are working with the Clinton Health Access Initiative, we are now procuring over 2,000 hearing aids for distribution to all our public health facilities and hospitals. And why is this? We are building on a very initial phase that has already equipped 27 facilities with the screening and diagnostic tools across multiple counties. So, Honorable Speaker, I have instructed KEMSA that hearing assertive technologies be now integrated into the National Logistic Management Information System, must be integrated into our Kenya medicine list that KEMSA and MOH has, and then we increase the screening and the diagnostic tools across multiple counties. Finally, the Ministry of Health, Honorable Speaker, will engage the National Treasury this year during the finance bill to propose amendments aligning the tax treatment of all hearing aids components, including essential parts, accessories, and consumables, are aligned and they are tax-free. This will help us ensure indispensable components of hearing aids are treated as integral medical device for persons with disability, rather than ordinary taxable spare parts, thereby reducing the out-of-pocket cost and advancing universal health coverage for persons. So we want to make sure that once that tax is removed, they can be financed and paid for under the Social Health Authority tariff. But the National Council for Persons with Disability has already initiated a framework agreement to strengthen the public procurement pathways of the whole country in terms of hearing assistive devices. Honorable Speaker. Honorable Speaker, what are our long-term strategies in place to enhance access to quality health care by persons with this condition, with hearing impairments? The Ministry is implementing the National Ear and Hearing Care Strategic Plan 2023-2028. This is a very comprehensive framework, and it's designed to expand both ear and hearing services across all levels of care in our health ecosystem. And this plan helps to establish hearing clinics in all the sub-counties and integrate prevention, screening, and treatment into the primary healthcare services under UHC. So to strengthen the workforce, our community health promoters, our maternal and child health nurses are being trained both at our middle-level colleges, at our universities. They will be trained in prevention, in early detection, and in referral. Concurrently, the University of Nairobi and KMTC and the Kenya Institute of Special Education are also scaling up how they can produce more audiologists and more speech, language, and therapists. Honorable Speaker, when I saw this question, I had to talk to the DG who is here. And I can confirm that as a country, we have serious shortage of specialists, even speech therapy. Even when we put the cochlear implant into our children at tender age, they recover very easy to hear. But the biggest problem is they recover and they take long on the speech therapy. So it's something we have seen, and I think we will talk to our training institutions and more Kenyans and to bring the curriculum and work through. Thank you, Honorable Speaker.
Senator Sifuna, do you have any supplementary question?
Indeed, Speaker, I do. Unfortunately for me, the ODM expert on PWDs is not in the House today, Senator Crystal Asige. But I do, if my memory serves right, we did pass as a House an amendment, Honorable Speaker, and I thought we touched on this question of taxation of assistive devices. It just doesn't make any sense why a government would impose VAT on essential components such as hearing aids. But I want to assure the Minister that we'll be following up when that tax conversation comes up to see that this government actually does away with taxation on those essential hearing aids. But since the CS has pegged down the capping of receipt of these assistive devices to 18 years to the cost of the product, and if you look at the response, it's saying that it is a cost containment measure driven by current resource constraints. Does the CS or the ministry have empirical numbers? How many people above the age of 18 in the country, or what percentage of the population is actually in need of these things, so that we actually know that it is a heavy cost to government and you're not just telling us stories? Because you've told us here you are undertaking actuarial assessments, which I believe must be based on data and numbers. Do you have those numbers, Waziri, on how many people above the age of 18 in Kenya require these assistive devices? I thank you, Honorable Speaker.
Senator Duale.
Thank you, Mr. Speaker. A quick one. Waziri, I have a patient who has a heart problem and currently admitted at Tenwek Hospital, Bomet. Now, what I'm getting is that SHA is paying 537,000.
Now, Senator Duale, you know the subject of
my question,
the
Mr.
subject
Speaker.
of the primary question.
Mr. Speaker, I'm building my case. It's on SHA. I'm just inquiring.
Yeah, but the question at hand, the primary question, is actually on the devices.
Mr. Speaker, I raised my request earlier on when actually Senator Hamida was on the floor. And
so it's not related to this question?
No, it's on SHA, Mr. Speaker.
I will allow you.
Thank you. So, Waziri, this patient is in the hospital and the bill is about 1.1. SHA is paying 530-something. The patient is supposed to pay the balance. Mostly on heart problems, people actually seek where they can be able to get quick response to their issues. I'm told there are criteria, or rather there are categories of payment for different hospitals and different diseases. So I really want to know more specifically on that particular patient or heart. I have about 4 patients from Isiolo who are having similar challenges, actually going around to raise funds to meet the cost of the operation. So do you have categories of hospitals and diseases that you pay different charges, especially those patients who are covered under SHA? I thank you, Mr. Speaker.
Senator Haji.
Thank you very much, Mr. Speaker, sir. Mr. Speaker, sir, before I go straight to the question, I just want to state that as the Senator of Garissa, I am very happy and proud when I hear senators like Cherargei and Cheriot and Senator Sifuna praise the CS of Health, who happens to hail from Garissa. Senator Sifuna, you did say that he answered your question. No, you said he answered your question, and you're very happy with his answer. So, as a Senator of Garissa, we're very happy and we're very proud of our son who hails from Garissa and he's got a very busy ministry and is doing a good job, and we want to wish him all the best. Mr. Speaker, sir, since regional cancer centers were established, they've been supported by the Ministry of Health through the supply of essential oncology drugs, which covered over 24 treatment regimens, including those for breast and prostate cancer. Over the past 1 year, we've seen a significant reduction in the supply of these oncology drugs. I would like to ask the CS to clarify whether if there has been any policy shift regarding the provision of cancer treatment drugs from the national government to the regional cancer centers, and how such changes affect facilities in marginalized regions such as Garissa County. Thank you, Mr. Speaker.
Senator Eddie Okech.
Thank you, Mr. Speaker. On the question by Senator Muma, Mr. Speaker, I didn't find it satisfactory. I've read the response here. Waziri, the question was, Mr. Speaker, when will the discriminatory age restriction be removed so as to allow adults with hearing impairments to access hearing aids under the SHE assistive device benefit package? Mr. Speaker, if you look at the response, I have no sense of idea of what timeline has been given by the CS. And with regards to that timeline, we need just to be very clear to be able to actually track that timeline, so that as Parliament we can actually be able to hold the ministry account to a timeline. So could the minister give us a timeline, not the narrative that is here?
Honorable CS, you may respond.
Honorable Speaker, let me start with the last question. If Honorable Senator Eddie Okech read my statement, it's not a narrative. It's giving very clear direction. And I think Honorable Senator for Nairobi question is, because I have said we are looking at the whole issue. There's an element of taxation which we want to sort it out in this finance bill of this year. There is an element of we don't have specialists, but the element of the benefit package, which you have, I'm sure you are interested in is that we are looking at the current package, and that is under the Package and Tariff Advisory Committee, which we have submitted. It's an independent body that looks at many, including the one of cancer from 550 to 800. So, Senator, we will give you timeline. Once if tomorrow or the day after or next month the tariff package based at the University of Nairobi, if they give us, and they do public participation, they talk to the patient, they talk to stakeholders. Honorable Senator for Nairobi, I did not, the global percentage is about between 6 and 7%. And I suspect the same for Kenya. So 6% of the Kenyan population fall within this category. And I will give more detailed once I go back to the office and get the division. But I think it's about 6%. 6% comes to over 60 million, for example, if we say it's about 10 million Kenyans who are close to it, who are under this. Senator Duale, yes. All our benefits for all is on the website of SHA. And all hospitals, both private, public, and faith-based, they use that. And it differs even within surgery. And I'm very happy to thank you for taking that patient to Tenwek. Tenwek is a place, I have never been there. I mean, I used to hear, I went there. And in a day they do close to about, I think, 10 to 15 cardiovascular surgery, open heart surgery. Some of the best doctor surgeons are there. And I really want to ask even the House that it might be very far and it might be in rural Kenya. But that facility, if you are in Bomet or that area, please visit. So I will, if you give me the name of that patient, I will look at it. But that patient is right, and I'm sure SHA does not pay everything. Maybe on that particular benefit, it's 500,000. But if you send me the name of the patient, I can ask the leadership of SHA if there's something that we can do. But Senator Sifuna, also 2.2% of Kenyans also have the same form of disability. Approximately 1 million persons, according to the last population census. Senator Abdul, but before I come to Senator Abdul, my sister, Senator Foisiolo, maybe we'll also look at the surgical package of that patient, because there are different surgical packages that the tariff is the same, and it's the same for all hospitals, both private, public, and faith-based. Kenyatta the same, will charge what Tenwek will charge, what Nairobi Hospital will charge, what Aga Khan will charge. My senator, thank you very much. At least I have not let you down. I am also proud of my senator. But yes, the Regional Cancer Center, at least in Garissa, with the help of the governor, and the same for, we are now doing with the governor for Nakuru, for the Regional Cancer Center, and the one in Mombasa. And Honorable Speaker, we are also building a cancer center in Meru for that region, and also in Nyeri, so that we have a lot of cancer. But the one in Garissa, number one, what we have done is we isolated it from the main hospital, and now it has its own SHA account. Before it was put together with the county referral hospital. So we've agreed with the governor and the leadership, now it's on its own account. So all the patients, and it serves about 10 counties, from Isiolo, Marsabit, Mandera, Wajir, Tana River, Lamu, Kitui. So it's a very busy place. I will even maybe, Senator, you need to help me that we need to, there was some hostels, wards, which were started. We need to finish the wards because the patients who come from far, they have a problem of accommodation, and it's a bit expensive for them. So what we agreed with these 3 regional centers, including Garissa, is that they buy the consumables, and then the Ministry of Health will take care of the servicing of the equipment. Because the biggest problem was the infrastructure. The machines were broken down very often as the patients are on the line. It happened in Kenyatta, now we have rectified. So Garissa Regional Cancer Center, Nakuru Regional Cancer Center, and Mombasa Regional Cancer Center, the Ministry of Health, using the tobacco fund, which is related to the upsurge of cancer as part of it, we are now paying for the service level agreement so that the machines are serviced, and it's a very expensive exercise. It's costing us close to about 200 million for those 3 counties. So I think I will talk to the people in Garissa and ask them why they are not buying the consumables. I think they should buy it's on their part. Maybe you'll help me talk to the governor. And these 3 centers, Honorable Speaker, I think just to give as I said, 44,000 Kenyans are infected, cancer is affecting them in a year. So we have made a deliberate move that we build another 4 cancer centers, one in Kisii, one in Nyeri, one in Meru, and one in Kisumu. And I really want to seek the support of the House to help me sensitize screening for cancer. We need to talk to our people. Early detection, early screening is very important. Most of them are detected when they are at a very advanced level. And many cancers can be treated if they are detected at a very early stage, Honorable Speaker. So Garissa, we are working, and I think I'll also follow up what the Senator has raised. Once I leave here, just like the way I'll do for Mombasa and KNH and MTRH and all the other cancer centers, both public, private, and faith-based.
Honorable Senators, looking at the time, We are 50 minutes behind the schedule because there is time allocation for every question. I know we have one question left for the CS to respond to by Senator Minda Kibwana. So I have several requests here which I suggest because they are actually on SHA and we left that question. After the CS finishes the question by Senator Minda Kibwana, I'll give the senators Modama, my good friend Senator Kongo Mugeni, Senator Mirachi, to ask those questions. A few minutes after he answers the question, responds to the question by Senator Aminda Kibwana. So Senator Aminda Kibwana asks question number 048.
Thank you, Mr. Speaker. Mr. Speaker, first I would also want to commend Bwana Waziri for tabling that report, for the job well done. It shows dedication, hard work, and he's actually equal to the task. And I'm very sure very soon we'll be calling him Dr. Duale with the expertise. My questions on 048, Mr. Speaker, is on Bwana Waziri, could you state the measures in place to operationalize the Kenya climate change and health strategy across national referral facilities and county health systems? Question B, what steps has the ministry taken to ensure that hospitals, clinics, laboratories, medicine supply chains, and emergency public health services remain functional during flooding, heat events, disease outbreaks, and other climate-related shocks? Question C, could the Cabinet Secretary state whether the ministry has conducted a national assessment of the vulnerable of health facilities and public health systems to flooding, extreme heat, vector-borne diseases, water contamination, and power disruption, and if so, what were the findings? The last one, what budgetary policy and infrastructure measures in the ministry adopting to strengthen climate health preparedness in line with practices used in countries that have integrated climate resilience into health planning, such as Bangladesh and the Netherlands? I thank you, Mr. Speaker.
OCS, proceed.
Honorable Speaker, the question by Senator Hamida is very, very important, not only to the Ministry of Health, but to the government and the people of Kenya. And that I want to confirm that we are operationalizing the Kenya Climate Change and Health Strategy 2024-2029 through very key measures and deliberate efforts. The first one is we are strengthening our institutions. A dedicated climate change and health unit has been established to coordinate implementation across the national referral facilities and county health system. And this is to ensure that we have a coherence policy and integration. Two, on vulnerability assessment, the Kenya Climate Change and Health Vulnerability and Adaptation Assessment has been initiated. Phase 2 has been completed by 31st of March 2026 with all the county level vulnerability profiles. All the ASAL and coast regions have been identified as high-risk areas. Phase 2 will form a costed health national adaptation plan. And the last one is climate resilient health guidelines. We have partnered support, and the minister has developed what we call green health guidelines. We have also done the resilient health facility guidelines, which are available. What does these guidelines do? These guidelines provide a framework for climate resilient infrastructure on sustainable waste management and how do we deliver a very resilient health service across our country. On coordination platform, the Kenya Green Health Platform is being established within the next 3 months and is supposed to coordinate implementation, supposed to track progress, and is supposed to strengthen accountability across national and county levels. On air quality and climate health intervention, the key actions that we did include the development of a household air pollution strategy, the training manual for our community health promoters, the 107,000, and this will help the community health promoters to strengthen the community level awareness and intervention. We are also establishing the Kenya Air Pollution Center of Excellence at Kemri soon. And as Kenya is a member and co-chair of the WHO-led Friends of Clean Air for Health initiative, this positions our country as a global leader in advancing clean air as a public health imperative. Honorable Speaker and members, our ministry is also strengthening the implementation of the Kenya Climate Change and Health Strategy through coordination with other institutions, making sure that we have evidence-based planning, making sure that we have resilient infrastructure standards that can withstand these shocks, and we have targeted air quality interventions. All these measures, I have said, will help our country prepare and the resilience of both at the national and the county level health system against any climate-related health risk. On what steps the ministry has taken to ensure hospitals, clinics, and laboratories and medical supply chains and emergency health public services remain functional, the Ministry of Health has instituted the following measures to ensure continuity of health services during the climate-related shocks. First is how we build resilient infrastructure, implementation of resilient health facility guidelines to strengthen facility safety, particularly in high-risk areas. So we have mapped out all our facilities across the country, particularly in the high-risk areas, to make sure that they have a very resilient infrastructure. Then, of course, we have, which is our core mandate, emergency preparedness. We have both strengthened the national and the county response system, making sure that we preposition enough supplies, we create a very rapid response teams, and we do emergency operation centers, working with colleagues in other critical departments. On supply chain continuity, that's why we said KEMSA now is fully recapitalized, so maintenance of buffer stocks, diversified sourcing, and improved logistics to ensure we are even introducing drones in terms of delivering items like blood during bad weather in some parts of our country. We are doing also surveillance and early warning, enhanced disease surveillance systems, detection and response to climate-sensitive outbreaks, the Rift Valley fever, and many, many others. Laboratory capacity, yes, working with the partners, including the US and other WHO, we have strengthened our laboratory networks and our referral system. Today, I want to confirm to the country that the samples we used to send to the US CDC and South Africa is no longer. We do a lot of our testing and samples both at Kenyatta and at the Kemri labs. Workforce capacity, we are training a lot of healthcare workers and community health promoters on how they can respond to emergencies and risk communications. Honorable Speaker, on the question of could the Cabinet Secretary state whether the ministry has conducted national assessment? Yes, we have undertaken a national assessment of the vulnerability of health facilities and public health systems through what we call the Kenya Climate Change and Health Vulnerability and Adaptation Assessment, and this is in line with the Kenya Climate Change and Health Strategy 2024-2029. Of course, I have said the phase 1 is completed, We completed by 31st of March 2026. And that phase 1 provides a very comprehensive county-level analysis of climate-related health risk and system. And what did we find out? We had very interesting findings. Geographical vulnerability. We found out that the arid and semi-arid areas and the coastal region were identified as the most vulnerable, with heightened exposure to drought, flooding, and extreme heat. We have also found out from this study that health facility infrastructure risk, a significant proportion of health facilities in the high-risk areas were found to be susceptible to flooding, inadequate drainage, heat stress, lack of power supply, and all this is affecting the continuity and provision of health care. We have also found out the disease burden patterns. In this assessment, we have confirmed that there's increased risk of climate-sensitive diseases. These include vector-borne diseases, malaria, waterborne diseases, which are linked to flooding and contamination and heat-related. So we also found the water and the sanitation and hygiene challenges, gaps were identified. We also identified gaps in the supply chain and service disruption. We also found out that laboratory and surveillance capacity gaps. Honorable Speaker and members, the ongoing phase 2 of this now will give us an opportunity and provide a more detailed and comprehensive national analysis. And its findings will form the development of a more costed. We want to put numbers to what we have seen for the people at the Treasury and our partners to see. And this outlining very targeted intervention so that we streamline the resilience of health facilities and the systems. On the last question, what budgetary policy and infrastructure measures is the ministry putting to strengthen this climate health preparedness? Let me speak for the Ministry of Health because it is a multi-sector. Our ministry is, the Ministry of Health is strengthening the climate health preparedness through a very deliberate targeted budget, policy and infrastructure measures. And these are informed by the international best practice, including lessons that we have learned from Bangladesh and Netherlands. On budget, I think there is an integration of climate health priorities into our medium-term expenditure framework and annual budgets with the allocations. And I have just sent a letter to the Minister for Finance yesterday asking for budget on this issue. I hope in his wisdom under the tight physical space, he will consider, and Parliament will consider when they are dealing with the annual estimates that will be tabled maybe next week. On policy and regulatory measures, operationalization of the Kenya Climate Change and Health Strategy 2024-2029 are all aligned with our national climate framework, and they are supported by what I earlier said, the green health and resilient health facilities. On infrastructure and system strengthening, we are retrofitting and upgrading health facilities for resilience to flood and advising our county governments and other private sector players, faith-based, they must build facilities that are resilient to floods, to heat, and power disruption. We are telling them and we are making sure that we promote sustainable energy solutions, and we also strengthen WASH systems and provide digital surveillance platforms. Finally, on capacity building, I think the healthcare workers are being trained, expansion on climate health research and establishment. These are areas I think they're very important, and I'm very happy, Honorable Speaker, that Senator Hamida has raised it. It's a very important area that has been neglected and was affecting us during floods, during drought, during heat waves. You see hospitals being submerged, outbreak of diseases which are related to the climate shocks. And finally, our multi-sectoral collaboration, we want to enhance the coordination with the government sectors and partners to support the integrated climate health response. Thank you, Mr. Speaker.
Mr. Kibwana, do you have any supplementary question?
Mr. Speaker, I just want to add from the response from Waziri Asante for your response. I was just wondering if there are any, so far, are you assisting counties to mainstream this strategy so that at least they can have their own strategies and assessing and concluding this as you have tabled? And also, are you leveraging on also any kind of support, external partnerships? I'm sure there are countries that would want to partner on such, mainstreaming. So at least for the counties also to implement, their own, and then also just have partnerships whom you can leverage on. Thank you.
Honorable Waziri. Yes, Honorable Speaker, thank you, and Honorable Senators. If you look at page 22 on phase 1, which we have just completed, 31st March 2026, we are completely aligned with the county level vulnerability profiles. And that's how we picked ASAL cost. So based on that report, and which we have shared with the counties, and everything we do, health is devolved. So as environment, most of it is devolved. So we're working with them, but I'm sure phase 2 is where now we want to inform a more costed national health national adaptation plan, so that the counties can plan in terms of how much resources they will inject. And then finally, I agree with you, there are many partners, many organizations who are ready to partner with us. And what we have done now in the Ministry of Health is that we have introduced a system where it is one budget, one plan, one budget, and one M&E. So donors don't just come and they don't go to a county and they start something which already. So we sit with the donors, with the counties, and we say, this area has been funded by government, this area has been funded by this donor, we have a gap here, can you please help? So we will talk to our partners, both at the UN level and at the other international level. Many of them are ready to support us.
I have several requests here. Now, there are the same members I mentioned. I will give an opportunity at the tail end of this discussion. So, Senator Mudama.
Thank you, Mr. Speaker, for this opportunity. And I just want to, first of all, thank the CS for coming, because many of the times we call CSs and they don't appear. So thank you, Bwana CS, for coming. I have a question about a patient who was admitted at KU Referral Hospital, and he died a month ago. SHA paid 1,200. Well, the bill was 1.202, and SHA paid 400. The balance of the bill was 800. Bwana CS, this man has only 3 daughters, and they are not working. They fundraised on the 13th of this month, and they raised 150. I was wondering, Bwana CS, at your capacity, what can you do, and is it legal for a dead person to be retained in a hospital because of non-payments, or they can come into agreements? The children of the deceased has already gone to the chief. The chief has written letters to the hospital. So, Bwana CS, I was wondering how you can assist for this body to be buried. Thank you, Mr. Speaker.
Before you get a response from the CS, I really wanted to know which other member has a supplementary question on the primary question first. You know, this is a technical area on climate change and all the strategy. It's a technical area. The CS is lucky that he served in the Ministry of Environment, and that is why he's able now to understand what Senator Minda wants to know. So, Senator Nyutu, Joe Nyutu.
Thank you, Honorable Speaker. My question to the CS is based on Part B of the question that Senator Hamida Kibwana asked on the steps that the ministry is taking to ensure that clinics, laboratories, and medical supply chains serve or are available to these institutions, public health, medical facilities during when we have disease outbreaks from climate change, Mr. Speaker. But then, Mr. Speaker, we also have a big referral hospital in this city by the name Kenyatta National Hospital. And there have been reports, Mr. Speaker, that sometimes supplies, even laboratory supplies, medicine supplies, are not available, which has been resulting from the fact that the government is collecting all the payments there through the e-citizen platform. So, Mr. Speaker, my question to the CS is, what informed this decision to have monies payable to Kenyatta National Hospital collected through e-citizen, which then means that the hospital cannot access those funds directly? And Mr. Speaker, you know, hospitals are doing very well in the counties when they collect these monies for themselves and use it for what we are calling Facility Improvement Fund. So exactly what informed this, and what guarantee do we have, Honorable CS, that Kenyatta National Hospital will continue having medical supplies and laboratory supplies in spite of the fact that the hospital does not collect this money directly because it is collected through an e-citizen platform? Mr. Speaker, that is my question. Thank you very much.
Senator Joe Nyutu, you know you are a bit crafty. You are touching on climate change and then diving again to Kenyatta National Hospital. Yeah? So that is why I'm asking any member, if there is no other member on climate change issues, then let's get another question from Senator Okongo Mugen.
Yes, Mr. Speaker, mine is a supplementary question to the answer that was given by the CS. And I first want to thank his ministry and the CEO of SHA, because they made an intervention for a patient. I think that was last week, who was being asked to pay an advance payment of 45,000 shillings in a private hospital in Kisii before accessing dialysis. And I think that was an attempt by the hospital to extort money from a patient who is fully covered by SHA. Now, Mr. Speaker, sir, the CS has emphasized that it is important for Kenyans to go through cancer screening. And I just wanted to get the thoughts of the minister, how he can assist the very vulnerable Kenyans who are supposed to get these services from our county referral hospitals, yet those hospitals don't have the facilities to do cancer screening. I can give an example of my own county of Nyamira. We don't have MRI machines. We don't have facilities that can allow patients to go through intestinal cancer screening. I think what they call endoscopy. If you go to a private hospital like Nairobi, I think they charge about 37,500 just for the facilities alone. The doctor will charge another 55,000 shillings. Yet at the counties, Mr. Speaker, I don't know about your county of Meru, but most of our counties don't have these facilities. In fact, in Nyamira, we don't have an oncologist. We don't have an MRI. We don't have a radiologist. So even if we urge Kenyans to go for screening, the only fallback is to go to our private hospitals. In that region, there is only one private hospital, Oasis, that can allow patients to go through screening. So my question is, can SHA the SHA card, especially Kenyans who pay 500 shillings, can they enjoy this service of early cancer screening in our private hospitals using the SHA cover? Because the facilities are not in our public hospitals. And Waziri, I'm willing to visit with you my county hospital of Nyamira, or you can make reference to the auditor's report, financial year 2024-25. He has highlighted that all these specialists have not been employed by our county government of Nyamira, plus all the 3 other level 4 hospitals. That is the situation. So I want to know whether that service can be available to the people I represent to get the cancer screening. Thank you, Mr. Speaker.
Okay, last but not the least, Senator Miraj Abdulilahi.
Asante Mheshimiwa Spika. Swali langu kwa waziri ilikuwa ni kumuuliza kuhusiana na masuala ya malipo ya SHA katika hospitali zetu kuu za referral, hususan ile yetu ya Pwani. Lakini katika changizo zake nimemsikia amesema ya kwamba tayari wametayarisha malipo hayo. Kwa hivyo yangu ni pongezi kumwambia ya kwamba sisi kama Wapwani tunaitegemea sana hospitali ile, na tumefurahia pia kusikia ya kwamba kuna facility ya kansa inaendelea kujengwa pale ndani. Asante Bwana Spika.
Kanuni ninazotumia hapa haziruhusu wewe utoe shukrani saa kama hizi, ni maswali tu ya ziada. Lakini ni vyema, wengi wameshukuru waziri na sina bundi na mimi pia kusema anafanya kazi jema. So there are 3 just supplementary questions from Senator Kongo Mweni and Senator Kibwana and Senator Njonyu. If you do that in 1-2 minutes, we'll be concluding with you, Waziri. Thank you.
Honorable Speaker, I will be very fast. Honorable Senator for Machakos, Senator Mudama, I really understand your case. SHA has paid 400,000. That is all they could pay as per the benefits of the patient. Now the patient has 800,000. From my experience, even now as a leader and when I was in Parliament, there are some bit you have to pay yourself. We have to do a rambe for that 800. Me, you, and many others. So, no, you have said only the family has 800. So what you do, send me the list. Please see how much we can raise. And then I will see how much the hospital can waive. And I will deal with that matter. It's very urgent. We don't want to keep bodies. It's against, it's immoral, it's unconstitutional. And I will do, but we should also protect our hospital. But that one, I'll deal with it. And there's a certain threshold that we can ask KU to RH to waive. 2, my good friend Senator Nyutu, I want you to go to Kenyatta Hospital today. Just yesterday alone, Kenyatta Hospital was paid 531 million by SHA. It was number 1. For many reasons. 1, it has a high number of patients. And 2, there is a new good leadership. We have removed all the corrupt ones. And the board led by Abbas Gulet, former Kenya Red Cross chair, and the Siampe who was before in Kenyatta, and now they are doing extremely work. 11 wards are being refurbished. Even their money, the little that goes through e-citizen platform, they get it. So what you read in social media is fabrication. In fact, I'll be going to launch another section of Kenyatta. I'll look for you. So Kenyatta is not the Kenyatta of the yesterday. And I really want to tell the country, both the private wing, and in fact the private premier wing of Kenyatta now is being used by our leaders. So Kenyatta is doing well. It has enough money, and e-citizen has transformed our country. Senator, e-citizen has transformed our country. You might not like the president who introduced it or the government introduced it, but while you are sitting here, you can use e-citizen platform to sort out many personal community issues and payment. And you do payment here, Kenya Power, whatever, anything, KRA. So I think it has challenges. The way even, I'm not saying SHA is 100%. We have some operational challenges. The way M-Pesa sometimes is in a kwama. But I can tell you, Kenyatta, and I'm ready to take you there. The supplies are there. They buy from KEMSA. Where they don't find KEMSA, they buy from the private sector. In fact, by next week, we are putting the 4th linear machine for our cancer patients. They serve 150. We want them to serve 300, 400. Kenyatta University is a premier. It serves Muranga, Kiambu, Machakos, the whole of that region. But Kenyatta Hospital is doing very well. I think there was a question from Senator Omogeni. Senator, I want you to listen to me. I didn't want to say this, but I have to say, healthcare in Nyamira has collapsed. And it has collapsed because of your governor. I want to be very honest with you. There are about 3 counties where healthcare is collapsed. Let me give you a very good example. All the things you have said, all the equipment you have said, are provided for under the National Equipment Support Program. I was in Bungoma, his counterpart. There is a radiology, there is a mammograph, there is dialysis machine, there is even a CT scan we have launched, all under this program. And he is not putting a coin. The national government is not putting a coin. It is fee for service. Every patient who uses it is paid for by SHA. Your governor and Nyamira, he has signed for the next program, but he's unable to make a request. He's unable to make a request, and I cannot force him. So if he make a request today, by next week, me and you will go and launch CT scan. We'll go and launch all these equipment. But I can tell, and it's good, I think I need to be very honest to Kenya and to the residents of Nyamira, that I think it is morally wrong, it is religiously wrong for you to be a leader and to be a governor of Nyamira, and you allow the most critical sector to collapse because of leadership. I didn't want to say this, but I have to say it. Even the primary health care, which is free, level 2, level 3, the dispensaries and the health centers, it is free. Government is paying for. And if you look at the money, if he does well in health and put the equipment, even the revenue of Nyamira County from the health sector will be the highest. I will give you a good example. Senator Miraj asked me, Coast General Hospital, yesterday we paid them over 235 million. I have the Chief Finance Officer of Shahia. I think it's about, it was number like 6. Nakuru General Referral Hospital. There are counties that have received close to 8 billion since SHA started 18 months ago. It depends on leaders. But because today the senator, a good friend of mine and a very progressive senator, even look at that 45K of dialysis. It's not even the price. Dialysis, the 2 sessions are fully covered by SHA. No Kenyan should be charged as long as he is a member of SHIF. Every Kenyan who goes for dialysis, 2 sessions, they are fully covered by SHA. There are few Kenyans who go for 3rd session. We are trying to look at the benefit package and maybe get it from another package. And maybe by the end of the year, we will make sure that all the dialysis package are covered. I have just said Nyamira is next to Kisii and Bungoma and Mandera. The private hospitals there are part of the fraud that is going in the country. Thank you, Mr. Speaker.
Okay. Thank you, CS, for your time to appear before the Senate. So, as you have heard clearly from the senators, they are happy with your work. Continue doing this and good work with your team. So, I want to release you to go and serve other Kenyans. So, Waziri, I have released you. Now, we are happy that you have been able to handle the questions nicely, because you have taken a lot of them, because you understand the subject matter of whatever is happening there. So, thank you very much indeed, and all the best. So, we have the next CS, the CS for Interior, National Security. So, I request the Sergeant at Arms to usher in the CS. I want to take this opportunity to welcome the CS for National Security, Interior and National Administration to the Senate. You are citizen, the friend of the Senate. So we have several questions on our senators. We really must manage our time. We have 11 questions, and then to do within this is 53 minutes. So, Senator Manzo, I want you to start with the first question.
Yes, Mr. Speaker, this is
question. Just a minute, because you have several questions. I want to see where we are starting. Question number 015.
Yes. Thank you, Mr. Speaker. Mr. Speaker, 015. A, could the Cabinet Secretary explain the circumstances surrounding the abduction and subsequent death of Mr. Emmanuel Mumo Divo, a resident of Lukenya Village, Masongalen Ward, Kibwezi East constituency, who was last seen alive on the night of 24th August 2025 in Nairobi? B, were the police at any point involved in the detention, custody, or handling of the late Mr. Ndivo between the time of his abduction and his eventual transfer to Nairobi City County Funeral Home? C, what official records or documentation exist regarding the circumstances under which the late Mr. Ndivo was found and taken to the mortuary, and why was his family not immediately informed by the relevant authorities? I thank you, Mr. Speaker.
Honorable CS, proceed and give your response.
Thank you, Mr. Speaker. Once again, I thank you, Mr. Speaker, for inviting me to come back to this august house to discuss these issues related to the security of our country. Considering the time given, and I do not pretend to advise the Speaker or the House, but Mr. Speaker, I have said this before and allow me to repeat that it would be nice if you invite us with those many questions to just restrict it to one Cabinet Secretariat session so that we do not rush all the questions at once, considering that how we schedule also our diaries is to take care of the serious business of the Senate. But be it as it may, I will abide by the calendar as has been provided. Mr. Speaker, on question 15, I will go straight to the answers because I don't have the time to repeat the question on part 1, which is regarding the circumstances surrounding the abduction and subsequent death of Mr. Emmanuel Mumo Ndivo. Mr. Speaker, the government is not aware of the abduction of Emmanuel Mumo Ndivo. On the contrary, the government is aware that on August 27th of August 2025, Mr. Jackson Kioko Ndivo reported the disappearance of his brother, Mr. Emmanuel Mumo Ndivo, aged 33 years, at Kangemi Police Station, via an OB number 1827/8 of 2025. He alleged that Emmanuel had gone missing since 24th of August 2025 at about 1800 hours. On August 29th, 2025, DCI Dagoretti commenced investigations into the matter. Call data records was requested from the mobile subscriber, and the report was subsequently delivered to the Nairobi Regional Crime Headquarters via reference number 3265 of 2025. Before the investigation could progress further, Jackson reported at the DCI Dagoretti office that the body of Emmanuel had been found lifeless at the Nairobi Funeral Home, admitted via number 1487 of 2025, allegedly having been involved in a fatal road traffic accident along Wayaki Way. Dagoretti Base Commander addressed the issue, and our preliminary investigations revealed that a report of a hit-and-run fatal road accident was filed at Kabete Police Station on August 25th, 2025, under OB number 25/24 of August 2025 at around 9:30 hours. It was reported that an unknown male body was lying in the middle of the road along Wayaki Way. Crime scene personnel visited and processed the scene, and upon examination, the body showed injuries consistent with the traffic accident. The body was removed to Nairobi Funeral Home by police officers from Kabete Police Station for preservation, pending identification and post-mortem. The base commander, Dagoretti, later on the same day circulated the same through a signal via Kabete Police Station OB number 2425/08 of 2025. On 9th September 2025, the Dagoretti base commander, through Corporal Mwanzia of Nairobi Funeral Morgue, supervised the post-mortem, which was conducted by Dr. Maingi, pathologist, and witnessed by brothers of the deceased, Mutua Ndivo, Francis Ndivo Kaesa, and Jackson Kioko Ndivo. The pathologist opined the cause of death as blunt head, chest, and abdominal organ injuries consistent with the road traffic accident. On whether the police were at any point involved in the detention, custody, or handling of the late Mr. Ndivo, Mr. Speaker, let me just say that at this point, it's becoming, there is a rampant behavior where even professionals at the level of lawyers and other educated Kenyans, when someone is arrested, they say he was abducted. Or when somebody is missing, they say he was abducted. Abduction is a technical legal term that denotes a particular action that has been done, not when someone is missing. When someone is missing, Mr. Speaker, there could be many reasons. Either he's hiding, or he has he's died, or he has been abducted, as may be the case. But to start a question by saying, answer the abduction of so-and-so is, Mr. Speaker, very erroneous. And it's becoming the norm now that anybody who is lost, or even when police arrest somebody, they say the police abducted. Police cannot abduct people when they are arresting them to take them to police station. Now, part B of the question on whether the police were at any point involved in the detention, custody, or handling of the late Mr. Ndivo. Honorable Speaker, from police records, there is no report indicating the abduction and detention of the late Emmanuel. However, there exists a report of a fatal road traffic accident. However, police officers from Kabete Police Station attended the scene of the accident and moved the body to a known person to Nairobi Funeral Home for preservation. The body was later identified by the family. Concerning the existence of records of documentation regarding the circumstance under which the late Ndivo was reportedly found and taken to the mortuary and why his family was not immediately informed by the relevant authorities, Honorable Speaker, within the police custody, there exists records on 1. Hit-and-run traffic road accident report at Kabete Police Station. 2. Circulation of base commander Dagoretti through a signal via Kabete Police Station on the 25th 8 of 2025, OB number 2425-08225, 2025. Nairobi City County Funeral Home, mock admission of an unknown body under admission number 1487, 2085. Report of a missing person made at Kangemi Police Station by 1 Jackson Kyoko Ndivo on 27th of August 2025. According to police records, all necessary procedures relating to a hit-and-run fatal traffic accident were duly undertaken as outlined above. The family was not immediately informed since the incident involved an unidentified body from a hit-and-run case, necessitating the identification process, which was eventually conducted by the family. So, in other words, it was not possible for the police to inform the family because there were no records to show the family of the deceased. Number D, on measures put in place by the National Police Service to ensure accountability in case of alleged enforced disappearance and prevention of further incidents. Honorable Speaker, the government remains firmly committed to upholding the Constitution of Kenya and safeguarding the fundamental rights and freedoms of all citizens. The government refutes claims of enforced disappearance, which is not sanctioned activity of the state. Such acts are criminal in nature and perpetrated by individuals or organized criminal elements acting outside the law. To mitigate and respond to incidents of abduction and to enhance public safety, the following proactive measures have been employed. 1, a dedicated response team domiciled at the DCI headquarters was formed to swiftly handle cases of abduction. 2, the police conduct or alleged cases of abduction. 2, the police conduct investigation to all reported cases, ensuring prompt arraignment in court of law for those found culpable culpable to deter future criminal activities. 3, members of the public to be sensitized to share information within the police through Fichua kwa DCI, toll-free number 08722003 and WhatsApp number 0709570000, ensuring confidentiality, reporting of crimes, and safety of the whistleblowers. 4, reactivating inactive community police committee to improve collaboration between the police and the community, fostering information and sharing, and early identification of security threats. Strengthening both foot and mobile patrols to prevent crime while reinforcing police visibility in key areas such as residential neighborhoods, marketplaces, and transport hubs. Let me conclude by saying, Mr. Speaker, that unfortunately there are also rising cases of self-abduction or staged abduction. And it is embarrassing that it's done by leaders who serve in such high offices, including members of parliament, former ministers, and so forth and so forth. And this culture of self-abduction or staged abduction is negatively impacting serious cases of abduction or enforced disappearance or missing persons, because people are using abductions for political gain. I thank you, Mr. Speaker.
Senator Manzo, do you have any supplementary question?
Yeah, Mr. Speaker, with your kind permission, because I've got 2 related questions, if I could kindly abandon the first
senators, we are really constrained by time.
If I could just go to the next one with your kind permission, Speaker.
And I will not take any question not related to the question, the primary question. Senator Manzo?
Yeah, with your permission, let me proceed with the number 16.
Or you have no supplementary question?
No, I'm on the next
on
one.
015?
No, but to save time, to go to 016 because they are related.
But the other senators who need something to on the same question that you have asked.
Okay, much
okay. Senator Haji Abdul.
Thank you, Mr. Speaker. Mr. Speaker, as you're aware, police brutality has become a matter of growing national concern, particularly in marginalized areas where public confidence in law enforcement continues to erode. Mr. Speaker, yesterday there was a bit of an unrest in Garissa County. A young man, 24-year-old taxi driver Aden Mohammed, was arrested, handcuffed, and then shot by a police officer named Charles Kaui, who is a DCI driver based in Garissa Police Station. Mr. Speaker, sir, I would like the Minister, the CS, to inform this House on the status of the investigation, if any have taken place, because it's to my understanding, Charles Kaui, who is the DCI driver, who is alleged to have committed the shooting, is at large and on the run. Could the CS inform us if he has been arrested or his whereabouts has been detected? And the shooting happened at the checkpoint of Modika Barak Junction corridor. Could also the CS inform us on the need for so many checkpoints on that road, and whether, if those checkpoints are lawfully gazetted, and what action has been taken against any that are found to be illegal, irregular, or operating outside the law? Thank you, Mr. Speaker.
Honorable Senator, as you know, that's why I say let us really stick to the primary question. I don't know now whether the CS has a report on yesterday's occurrence, but Honorable CS, just try and see whether you can answer Senator Haji, then I will do another round. Yes, no problem. We are still there.
Thank you, Mr. Speaker. Mr. Speaker, actually, without overruling you, I need your attention, Mr. Speaker.
Speaker.
Yes, without overruling you, Mr. Speaker, the question number 15 and 16, in any way, without challenging your authority, the question number 15 and 16, to agree with Senator Manzo, is exactly the same. The next one is about missing persons, the 16. So that if there were going to be clarifications, it would have been good to combine 15 and 16 so that the clarifications related to missing persons can be the same, in my own opinion, so that any responses on that issue, because the question 16 has statistics of disappearance or missing persons and so forth. But let me just capture the issue of the Senator of Garissa. The question related to yesterday's unfortunate incident where a police officer, I think called Charles Nguni, was actually attacked and killed a civilian in a roadblock is unfortunate. The report I have now, Mr. Speaker, is that that particular police officer is on the run. The DCI officers within the county are chasing after him. We believe that he should be arrested any time from now. More importantly, IPOA has been invited to take the proper legal steps and being assisted by the officers from DCI. As soon as the suspect arrested, we will take him, working together with IPOA. He will be taken to court and the processes will follow. These cases, Mr. Speaker, of police brutality are taken very seriously by National Police Service, investigated. But I must say that as a ministry, we have been advocating for better budget for IPOA because they are grossly underfunded and making it difficult for them to carry out their responsibilities of oversighting and holding into account police officers who are found in such cases as the case in Garissa. I promised the Senator that I will be on this case, on the case of the IG, to ensure that there is accountability on the part of the National Police Service on this particular matter. I thank you.
Senator Mudigi.
Okay, asante Bwana Spika. Swali langu kwa waziri, tunaona ile kazi unafanya kazi ngumu na imeleta shida katika Kenya. Swali langu Bwana waziri, Embu County huko Mbere North pahali inaitwa wondi inaitwa Evrole Wondi, tarehe 14 mwezi hii watu wa huko walikuwa demonstrating juu ya shida ya hospitali, lakini kwa bahati mzuri ama bahati mbaya wakiwa na, unajua sheria inasema mtu anaweza kudemonstrate na uko na uhuru, kulitokea shinda kijana mmoja anaitwa Morris Njue Njoka Patrick Karioki Munene, askari alitupa funduki akaua vijana wawili. Bwana waziri, kila wakati wote kukitokea mambo ya maandamano, askari wamekuwa na shinda hizi, na ninajua hakuna mtu anaweza kusema atienda ukandemonstrate alafu askari akuja uwe, hakuna kitu kama hiyo. Swali langu Bwana waziri.
Senator Mudigi, naomba ulize swali moja.
Swali langu Bwana waziri. Okay, asante Bwana Spika. Swali wangu Bwana waziri, ni njia gani mpaka leo kwa hiyo masiku umechukua ndio watu wa Embu County wanjue ukweli wa huyu askari ameshikwa ama anjeshikwa, ama kuna njia yoyote unaweza kutumia kitendo kama hiki kitiwe inaweza kuonekana wakati mwingine kuwe na kila sub county ama county kuwe na watu wa kufunza askari, ndio kusiwe kunatokea mambo kama hii, mambo ya dialogue na mambo ya watu, kwa sababu askari wamekuwa akifanya vitu kama hii na inaleta shida katika nchi yetu ya Kenya na inaharibu jina ya serikali. Asanti Bwana Spika.
Senator Nyutu, and please be precise to your question.
Yes, I will be, Mr. Speaker, and thank you for this opportunity. I just want to, before I ask my question, to notify the CS, that abductions are done by the police and not criminals. Criminals would ordinarily kidnap victims for monetary gain. So my question to the CS is, exactly, does it worry you, Honorable CS, when you find police officers in uniform, hooded, meaning they are hiding their faces while arresting or doing whatever it is that they do, because they are always hooded? What is the place of hoods in the police force? Because, Mr. Speaker, a police officer, if they are doing things that are lawful, they should not be hooded. So my question is, why do officers continue operating while wearing hoods? Because that is when they perpetrate criminality. Thank you, Mr. Speaker.
Senator Okech.
Mr. Speaker, I really need your attention on this, because it seems like the previous speaker who has just left the seat of the chair, Mr. Speaker, did not get what the CS said. Mr. Speaker, on this issue of abduction, the CS expressly said that there is an ongoing element of self-abduction. In his response, there is an ongoing element of self-abduction by senior members of this society, including some serious positions that have been in this country, Mr. Speaker, in the past. Now, Mr. Speaker, you know, this is a very important issue, Mr. Speaker. You know very well that this is a House of Parliament. And as a serious issue as abductions that have been going on in the country, if there is an impairment of dealing with abduction because senior members of this society are doing self-abduction, and the CS comes to this House and expressly says so, he must substantiate, Mr. Speaker. He must give us fact of who are these senior members of the society that in his tone and texture he has indicated. Can he give us the name of these people who are doing self-abductions and making it difficult to deal with the issue of self-abduction in the country, Mr. Speaker? This is a House of Parliament. We cannot just let it go as if it was just a bypassing statement.
Thank you,
because otherwise
Senator.
it becomes an impairment to justice.
Thank you for your question. Senator Veronica.
Thank you, Honorable Speaker. I wanted, first of all, to seek that same clarification on the abduction because I was of the view that Senator John Nyoto is misleading after the CS has confirmed that the term abduction is specific and technical and has defined what abduction entails, and that when a Kenyan is being arrested, is not being abducted. If they are being arrested by police, it's not an abduction. But since Senator Eddie has raised it, I will not repeat it. I'll ask Honorable CS to explain to us or to just give us information on what his office is doing regarding Kenyans who are tricked into accepting jobs in Russia, and it turned out they were being taken to the battlefront between Ukraine and Russia. And among those was James Mushoki Mwangi, whom the family cannot trace and has no connection with.
Senator Veronica,
yes.
You're going way out of line. You should stick to the primary question. So, CS, please answer the supplementary questions, and then we'll go to the main questions.
Thank you, Mr. Speaker. A number of questions have been asked, but let me start by saying that the question of by Senator Mundiki on the police brutality in Everori in the Mbeere North, I must say that that was an unfortunate situation. Investigations are ongoing to establish exactly why. If Kenyans were having peaceful protests, how come and how did it end at a police station? And because we were told the protest was about health facilities, but instead the protesters apparently charged at the police officers within the police station. That is alleged. So investigation would establish whether the protest was peaceful, whether it targeted police station, and whether the police officers who used their firearm and which eventually killed two young people or two people, Mr. Speaker, whether it was a legitimate use of force or it was a misuse of firearm. Number two is that that investigation, to facilitate proper investigation, the Inspector General of Police, following the required procedures, has suspended those two officers. They are not in office as we speak, to allow proper investigations. Investigations also to ensure that the investigations are free, fair, and accountable. The Independent Police Oversight Authority, IPOA, is seized of the matter, and they are carrying out the investigations. And I repeat my earlier statement that we are working hard to facilitate process of empowering the IPOA so that they can have enough resources and investigators to carry out investigation expeditiously. Ballistic analysis is ongoing, forensic analysis of the information that will enable us to deal with this issue with finality. I condole with the families of the two men who were killed and pray that they may find justice. And I promise as a cabinet secretary in this department that we'll do everything to facilitate processes of accountability within the police service. Senator Newto, I hasten to say that police officers are not in office to abduct people. Anybody who carries an abduction is a criminal. It doesn't matter whether he's a serving police officer or is in office or is a civilian or any other person. Any abductions that are done or enforced disappearance are illegal. Police officers are only allowed to arrest a citizen and produce them in court within 24 hours. Anything beyond 24 hours, again, is illegal because it's a violation of the Constitution. The Constitution requires that if you must hold a citizen beyond the 24 hours, it must be with the consent of the court. And so 24 hours is mandatory and that is the right. Anything beyond that is unconstitutional. The hooding of police officers' uniform, includes hoods, are used in certain circumstances for operational reasons, especially when you need to protect the identity of the police officers when carrying out dangerous operations that deals with people like terrorists, sometimes bandits, sometimes gangs. Gangs are very targeting of police officers. And I am glad that the Senator appreciates that sometimes those gangs and criminals may be within demos or in public space or any places that can be, and the police officers are rightly to protect themselves and protect their identity so that they are not targeted by dangerous criminals after carrying out the responsibilities they do. But by law, once they do so, they arrest the person and they must produce them in court. You need to know that our police officers operating in serious areas like the border of Kenya and Somalia face dangers every day. And if you were to force them to be seen, or those who are operating in areas infested with bandits are always facing dangerous criminals who are ready to revenge. And hooding and protecting our police officers is the responsibility of the National Police Service to provide the necessary uniform. On the question of Senator Okech, in terms of self-abductions, I don't think Senator Okech has just come from Mars. He's not a stranger in Jerusalem. He was in town when the Honorable Koimburi abducted himself, and then there was a man, and the impeached deputy president went to the hospital, and then he was even lying to Kenyans that Koimburi cannot speak. He was given chemicals and so forth. I am glad that the alleged victim then, Honorable Koimburi, has now laid bare that this was an act of drama, Mr. Speaker, that was only meant to win Kenyans. And up to now, the impeached deputy president has never apologized to the people of Kenya. He continues his lies. He progresses. So he's looking for another drama to try to paint the government National Police Service in bad light. Mr. Speaker, the same happened to Honorable Tuju the other day. Self-abducted, ran around. Only, Mr. Speaker, to be found, he was in his bedroom, relaxing and sleeping there. The former deputy president, the former vice president, who was leading the charge to paint the government negatively, up to now has not apologized, despite the fact that Honorable Kalonzo Musyoka is my personal friend. I found that was a very embarrassing situation he found himself in. Being part and parcel of a script, Mr. Speaker, that is painting self-abductions. The last case, Mr. Speaker, involved a young man called Diagui Kinyanjui, who actually forced the DCI to be dragged to a police station, to the court. And I think it was Justice Mwita, now a Court of Appeal judge, who really berated the DCI and, banged the tables. But, Mr. Speaker, when it was found finally that Diagui was just having his kideri, relaxing in his house, up to now, Justice Mwita has never apologized to the Inspector General of Police, the DCI, or the people of Kenya. So, Mr. Speaker, these three cases, among others, paint a very bad picture because all of these three gentlemen I've mentioned are role models and leaders of their own right. But they are painting a very bad picture of the National Police Service, but also they are, Mr. Speaker, embarrassing and making fun of serious cases of disappearance, abductions, and forced disappearance, and the victims and the families feel really very sad that some people are acting skits and so forth on this particular issue. So, Mr. Speaker, I thank you.
Thank you, Cabinet Secretary. Senators, with your indulgence, because of time, we have several questions which have not been asked. what I propose we do is to have the questions asked, the CS to reply, and then we take supplementary questions thereafter. Senator Mazayo. You will ask. We'll ask all the questions. Senator Mazayo.
Yes. Thank you very much, Mr. Speaker. Mr. Speaker, my question is to the CS. Interior and National Administration, or Interior Security, as follows. First, maybe I want to say that the minister is, I know he's a hardworking minister, but of recent, I think he has received very bad publicity on...
Senator Minority Leader, you have a question, go straight to the question.
Yes, but I have to introduce what I wanted to
There is
say.
no introducing the question, Senator.
Thank you for your guidance. I want to ask, number one, is what has the ministry, what is the ministry's current strategy for maritime security, and how is Kilifi County classified within the National Maritime Risk Framework? B, or number two, why has Kilifi County, despite its long coastline and strategic position, not been prioritized in the deployment of Kenya Coast Guard services? C, could the Cabinet Secretary provide a report on the status, capacity, and distribution of Coast Guard assets along Kenya's coastline, and clarify the criteria used in their allocation? And finally, what immediate and long-term measures is the ministry putting in place to current equitable deployment maritime security infrastructure and personnel across the coastal countries?
Thank you. CS, let's take all the questions, then you'll reply. Senator Manzo.
Thank you, Mr. Speaker. Question number 16. A, could the Cabinet Secretary provide a data on the number of individuals that have reported missing since 2022, indicating those that have been found alive or dead, and the number still unaccounted for? B, have the police or other security agencies established who was involved in the disappearances, and if so, could the Cabinet Secretary provide details on the actions that have been taken to bring the individuals to book? C, what measures is the government implementing to address the increasing cases of abductions in the country, and specifically ensure accountability in respect of enforced disappearances? Mr. Speaker, D, could the Cabinet Secretary provide details on the physiological and other support mechanisms, psychological and other support mechanisms available to abduction victims, and indicate whether financial compensation has been provided to any victims or their families? Mr. Speaker, I had one final one. If you allow me, I can read through.
Senator, because of time, we can't. Senator Ojenda, Senior Counsel, Professor, ask your question.
Thank you, Mr. Speaker. Mr. Speaker, my question is addressed to CS Interior. Number one, could the Cabinet Secretary explain the circumstances under which police officers were deployed to Itima Anglican Church in Othaya, Nyeri County on 25th January 2026, and disclose the identity of the persons who authorized and commanded the operation? Two, what steps did the authorizing and commanding officers take to ensure the deployment and conduct of officers on the scene as consistent with the national, and whether it was consistent with the National Police Service Act? Three, Are there internal controls or supervisory review mechanisms that are triggered prior to the deployment of the officers to sensitive civilian settings such as the place of worship? And if so, could the CS indicate whether they were triggered in this case? And lastly, what measures have been put in place to ensure that similar deployments in future are properly approved, documented, and supervised in a manner consistent with professionalism, discipline, and neutrality of the National Police Service? Thank you.
Senator Hamida.
Thank you, Mr. Speaker. My questions are, Bwana Waziri, could you kindly provide a status update on the investigation into the murder of Advocate Kyalo Mbobu, who was shot dead on Tuesday, 9th September 2025, including whether any suspects have been apprehended or questioned? B, what challenges have investigators faced in resolving the case, especially in regard to the closed circuit television CCTV footage and other forensic evidence? C, could the Cabinet Secretary outline the steps taken since the murder of the advocate to ensure continuous functionality and rapid access by security agencies to public CCTV footage as a deterrence and investigative tool, and provide details on the current extent of public CCTV surveillance coverage in Nairobi and other major urban centers? D, what measures has the ministry put in place to strengthen community-based intelligence, anonymous reporting channels, and witness protection to improve detection and disruption of violent criminal networks perpetrating targeted killings? And finally, Waziri also outlined the broader security and criminal justice reforms being implemented to address the rising concerns over targeted killings, general insecurity, and lack of swift justice in high-profile murder cases. I thank you, Mr. Speaker.
Senator Mofire. Give him the mic.
General, thank you. Thank you, Honorable Speaker. Honorable Speaker, I could get to know from the minister when will the government establish additional evidence-imputed national identification, country registration, and the correction centers across Tharaka County and other counties where residents have to travel long distances to access these services. Number two, Honorable Speaker, would the government also consider deploying mobile registration and the collection system to address the accessibility challenges faced by youth seeking the services in the affected counties? Thank you.
Thank you, Honorable Senators. Honorable Senators, we are going to defer question number 18, question number 20, question number 21, and question number 30, and allow the CS to reply to the questions that have already been asked. Cabinet Secretary.
If you may, Mr. Speaker, I will, if you allow me, I'll do it chronologically so that I start with question number 11 and then it flows. On the first question related to Witima Anglican Church, that is question number 11. Mr. Speaker, asked by Senator Ojenda. For part one, Mr. Speaker, concerning the circumstances under which police officers were deployed and the identities of those who authorized and commanded the operation. Mr. Speaker, on 25th of January 2026, it was reported at Witima Police Station that unknown individuals lobbed tear gas canisters inside Witima SK St. Peter's Church during service that was attended by, among others, the former impeached Deputy President Rigathi Gachagua. It was further reported that the attackers were dressed in civilian attire, had concealed their identities, and were operating motor vehicles believed to be associated with the police service. The individuals caused extensive damage to motor vehicles that had been parked within the church compound. Following the report, the Nyeri County Security Team visited the scene for inspection and processing. Inquiry file number 1 of 2026 was opened by the Directorate of Criminal Investigation, Nyeri South, to investigate the circumstances surrounding the incident. Subsequently, the Inspector General of Police directed the Internal Affairs Unit to take over investigations in order to ensure an independent and impartial inquiry, particularly in light of the allegations suggesting possible involvement of police officers. The Internal Affairs Unit has since submitted a preliminary report indicating, among others, the findings that the church leadership confirmed that they were not informed in advance of the visit by Mr. Rigati and his entourage, and neither the police nor other government authorities were notified of the planned visit. 2, the attack appeared to be linked to local political rivalries, which may have influenced its coordination and execution. 3, when local police officers attempted to respond to the incident, they were blocked and confronted by members of public who accused them of complicity. Investigations are ongoing to identify and apprehend the perpetrators, and the matter is pending under investigations. But Part B, Mr. Speaker, steps taken by police commanders to ensure deployment and conduct were consistent with constitutional and national police service standards. Honorable Speaker, following the incident, an internal inquiry established that no formal request for police security had been submitted by the church in respect of the service. Additionally, the officers commanding police station Witima had not received a prior notification of the event and was unaware of any high-profile guest, high-profile guests would be in attendance. As a result, there was no sanctioned police deployment for the event, and the officers who responded did so after the incident had already been reported in line with their statutory duty to maintain law and order. Number 3, Part 3, internal controls and supervisory review mechanisms governing police deployment to sensitive civilian settings. The deployment of police officers to provide security in public functions, including events held in places of worship, is governed by the Public Order Act, which outlined procedures for notifying the police of a planned public gatherings. The law requires any person or organization intending to convene a public meeting, procession, or event that may require security arrangement to notify the officer commanding the nearest police station at least 3 days and not more than 14 days prior to the event. Upon receiving such notification, the OCS assesses the anticipated size, risk level, and logistical consideration of the event. Where the available personnel are deemed insufficient, the matter is escalated through the chain of command for authorization of additional officers. An operation order is then issued to guide the deployment and conduct of officers in accordance with the Constitution and the National Police Act 2011. In the case of Witima Church incident, these internal control mechanisms were not activated because the police were not notified in advance of the visit of the former Deputy President and his entourage. Number D, regarding measures put in place to ensure the future deployments are properly approved, documented, and supervised, Honorable Speaker, notwithstanding the statutory requirements for prior notification, police commanders have been directed to enhance situational awareness within their jurisdiction by proactively monitoring scheduled events, including social and religious gatherings that may not ordinarily trigger formal notification requirement. This directive is intended to enable commanders to take timely risk assessment and, where necessary, put in place appropriate preventive security measures to forestall potential breaches of peace, particularly where high-profile individuals may be in attendance. Honorable Speaker, the government remains committed to upholding the professionalism, neutrality, and constitutional mandate of the National Police Service. Any officer found to have acted outside the law or established procedures will be subjected to appropriate disciplinary and legal action upon conclusion of the ongoing investigations. Thank you, Honorable Speaker. I will go to the, I don't know if you had number 12. Yes, sorry. On number 12, regarding the murder of, as I've said before, my former teacher, Advocate Chalo Mbomu, I'd like to respond as follows, Mr. Speaker, and this is issue I'm responding for a second time. The state has updated on the investigation in the recent murder of Advocate Chalo Mbomu. Honorable Speaker, on 9th of September 2025, at about 1740 hours, Mr. Matthew Chalo Mbomu, an advocate, was driving along Magadi Road on his way home from work when he was accosted near Brookhouse International School by two unknown assailants on a motorcycle, one of whom was armed with pistol. Owing to heavy traffic caused by ongoing construction and diversions along the road, he was driving at a slow speed before he was fatally shot 8 times. The incident was reported in Langata Police Station and later taken over by Directorate of Homicide on 11th of September 2025. The scene was processed and 4 spent cartridges were recovered. The vehicle was towed to the Homicide Investigation Bureau yard for documentation, while the body was removed to Lee Funeral Home for post-mortem examination, which was conducted on 11th of September 2025. The Chief Government Pathologist, Dr. Johansen Odwar, in the presence of family pathologists, opined the cause of death as multiple injuries due to gunshot wounds. 2 bullets heads were recovered from the deceased body, and together with the spent cartridges were submitted to DCI Forensic Laboratory for ballistic analysis. CCTV footage from the Segret Hotel townhouse where the deceased office was located and Brookhouse International School was retrieved for analysis by investigators to provide actionable leads. Several witnesses, including staff members from Chalo Mbovu, Chalo and associate advocates, have been interviewed and their statement recorded. Investigations led to the arrest of 3 individuals who had interacted with the deceased on the material day at Segret Hotel. During the arrest, 2 of them were found to be licensed firearm holders, and their firearms were recovered and subjected to ballistic analysis. Results excluded the firearms from involvement in the shooting. Further, no evidential link was found connecting the 3 individuals to the fatal shooting. On 16th of September 2025, investigators traced an eyewitness, Mr. Collins Amudavi, a construction worker at the bridge site near the scene. He confirmed observing a motorcycle rider waiting with the engine running near the diversion point shortly before hearing gunshots. He described the shooter as a person who was wearing a black face mask, gloves, hooded top, reflector jacket, and sweatpants. The shooter fled on the waiting motorcycle at high speed towards Galleria Mall. CCTV footage from the Brookhouse International School corroborated the presence of the motorcycle trailing the deceased vehicle. However, identification of the assailants was hindered by the use of helmets and face coverings, and the registration number plate was not clearly captured. Multiple investigation angles have been exhaustively pursued, including a gold and alleged German antiques transaction, a Korat African land transaction, a Mavoko land parcel dispute that he was handling, a professional petition or any possibility of professional petition or legal threats, which we never, no link was been found. Ballistic link analysis also indicates that the 5 spent cartridges and 2 bullet heads were subjected to forensic comparison. The ballistic report indicated that the cartridges were fired from a Seska pistol CZ85B model or similar firearm. However, no match was established with any firearm recovered during investigations. The murder weapon remains unidentified. Allegation by Captain Kungu Muigai. Following social media allegations by Captain Samuel Kungu Muigai claiming knowledge of the perpetrators, he was summoned and interrogated. He alleged the existence of a sealed affidavit and audio recording relating to a case involving judicial corruption. Searches were conducted at the deceased office and resident safes in the presence of family and legal representatives. No such envelope or recording were recovered. The claim remained unsubstantiated. Given the complexity of the matter and the multiplicity of the investigative angles pursued, the case remains pending investigations. On the challenges the investigation faced in resolving the case, Honorable Speaker, the last functional HD CCTV site before leaving Nairobi city boundary is located near Langata Road, Makadi Road Junction. Beyond this point, the CCTV camera installed along Magadi Road is inactive and therefore not operational at the time of the incident. It is important to note that the most CCTV cameras within Nairobi CBD and along the route taken by the deceased were non-functional, compelling the investigating team to rely on footage retrieved from private premises, including Segret Hotel, the deceased office, block, townhouse, and Brookhouse International School. Nonetheless, the DCI is not relying solely on the CCTV footage, but continues to pursue other investigative avenues to generate credible leads. Regarding the steps being taken since the murder of the advocate, Honorable Speaker, the National CCTV Integrated Command, Control and Communication System currently provides extensive surveillance coverage in Nairobi and Mombasa. This system comprises approximately 1,899 surveillance cameras and 281 NPR cameras deployed across 664 sites nationwide, with Nairobi hosting the largest concentration. Coverage includes Nairobi CBD and key arteries such as Thika Superhighway, Mombasa Road, Jogoo Road, Ngong Road, Wayaki Road, as well as critical installations including airports, government buildings, and major intersections. The IC3 surveillance infrastructure is fully integrated into the operational framework of security agencies, providing them with direct real-time access to CCTV feeds, archived footage, and advanced analytic tools to support investigations and enhance safety. However, the continued accessibility of these systems remain dependent on leased network infrastructure and collocated data centers, underscoring the need for long-term migration to government-owned network to guarantee uninterrupted access and operational independence. While some of these cameras remain operational and critical to policing and investigation, the overall effectiveness of the system is constrained by damage, dependence on leased fiber infrastructure, and inactive sites. The existing CCTV and ANPR systems have been in operation for over 8 years. The natural expiry of their product life cycle, both hardware components such as servers, storage, and network devices, and software have reached end life and can no longer sustain reliable operation. In areas where public CCTV cameras are non-functional, the National Police Service supplements surveillance efforts through partnership with private entities including hotels, schools, and office blocks, which provide CCTV footage upon request to support ongoing investigation of security operations. A proposal to expand CCTV coverage to additional major towns is underway. The government is working to restore all non-operational cameras and extend surveillance coverage beyond Nairobi and Mombasa. The next question is regarding measures put in place by Ministry to strengthen community-based intelligence. Honorable Speaker, the government is revitalizing community policing, establishing dedicated online like Fichuak or DCI, embracing community engagement on security matters, including the now established Duale Usalama, which has proven highly effective in fostering trust and cooperation. Building on the positive impact of these forums, commanders have been encouraged to, in liaison with the local administrators, to replicate similar barazas with wananchi from time to time, to provide platforms for sensitization on relevant laws, conservation efforts, peaceful conflict resolution, crime prevention, thereby strengthening community policing and enhancing public participation in security matters. So Duale Usalama is not an event, Mr. Speaker. I see many people are struggling to understand what it is. It's not an event. It's a concept that is applied in the security management from when we established last year onwards. And it's an ongoing process. And I encourage senators to participate in Usalama forums in their own counties and to organize others with their county security and sub-county security teams, because this is the only way we can be able to sort out security challenges in our locality. On the broader security and criminal justice reforms being implemented, Mr. Speaker, allow me to say them in bullet forms so that then, because the detailed statement has been provided, we are, Mr. Speaker, first of all, let me say that there is ongoing operational modernization, especially on the technology side. We are in another promise, maybe a month at most, we shall have completed procurement processes of establishing a massive technology application in the police sector. That will include digital OB, Mr. Speaker. It will include CCTV cameras in 7 towns in Kenya. That includes Nairobi, Mombasa, Nakuru, Kisumu, Eldoret, Nyeri, and Meru. It will also include the 7 command centers. It will also input computation, Mr. Speaker, so that the IC3 will be upgraded to be IC4, which will be communication, command, control, and computation, so that data analytics, including AI, will be used to analyze matters of crime. Mr. Speaker, this also will include CCTV cameras in every police station across the country, including ICT equipment in all the police stations, and also tablets that will be given to administrators, including chiefs, to make sure that they do their job better. These were some of the key proposals of Jukwaa la Usalama, and we are now implementing them, including a system of reporting, a technological system of reporting. Mr. Speaker, on mobility and deployment, we have also, pursuant to the Jukwaa la Usalama proposal, we are ensuring that police officers cannot serve in one place for more than 3 years. The system is being put in place to ensure that there is mobility and rotation so that police officers do not become complicit and become familiar and complicit in the areas they serve. On oversight and accountability, both IPOA provides the oversight and external checks over the police, but also we have internal affairs unit that does internal checks within the police, and also there is the work of the Kenya National Commission of Human Rights and general civil society that are monitoring the works of the police. We are also training our officers now on human rights. We are on human rights and change of culture and behavior. This is a curriculum that is being emphasized, especially with the 10,000 police officers that are undergoing training now. The next question, Mr. Speaker, is number 16.
Number 16. And CS, I would urge that you peruse very fast because we already have the answers circulated.
Thank you.
Honorable Senators, we are going to extend the sitting to 1:15 so that we can give a chance to the CS to conclude. Thank you, CS.
Thank you, Mr. Speaker. On the question of number 16, I'll go straight regarding missing persons in the country. Part 1, regarding the data on number of individuals reported missing since 2022. We have provided the data there, Mr. Speaker. You will see in 2022, there were 153 missing persons, 2023, 128, 2024, 159, and 2025, 131. And to help Senator Manzo to have a proper comparative analysis, we have provided that for 2016, which was 154, 2017 it was 148, 2018 it was 165, 2019 145, 2020 was 168, and 2021 was the highest in terms of missing persons, 2019, which were 219. From 2021 down, from 2022 there has been downward de-escalation, including last year. The missing persons were the lowest in the last 10 years, which was only 131 persons. On whether the police established persons involved in the disappearance, the National Police Service, through Directorate of Criminal Investigation, actively investigated all reported cases of abductions and disappearance or alleged abductions. These investigations have led to arrests in several instances, with suspects arraigned before courts of law. Some cases are at advanced stage in court, others remain under active investigations, while a number have been concluded as indicated in the table above. However, investigations have faced certain challenges. In some instances, individuals who resurfaced after alleged abductions declined to record statements, Mr. Speaker, thereby limiting the ability of investigation to conclusively determine the circumstances of their disappearance. Further, there are cases where it was established that individuals had voluntarily gone into hiding for personal reasons and not abducted. Concerning measures implemented by the government, Honorable Speaker, the government has implemented various measures, and I want to say that there is a specialized abduction unit within the DCI now. There is an enhanced mechanism of reporting through Fichua kwa DCI, strengthened investigation and prosecution, revitalized of community policing. All that, the details in the report. Regarding details of the psychological and other support mechanism available on abducted victims, Mr. Speaker, our victims and their families are guided on how to access psychosocial support services, including counseling and trauma care, through relevant government institutions and partner organizations to help them cope with psychological and emotional impacts of such incidents. In addition, the government ensures that affected families are kept informed of the progress of investigation as part of its commitment to transparency and victim support. However, the ministry does not currently operate a dedicated financial compensation scheme for victims of abduction or their families. Notwithstanding this, affected families may pursue compensation through existing legal and institutional framework. The last question, Mr. Speaker, is number 23 for today, which is
22 and then 23.
Okay, both 22 and 23. Thank you, Mr. Speaker. Identification card registration, collection centers across Tharaka Nithi County. Part 1, on the establishment of additional, this is the question of Senator Mwenda of Tharaka Nithi, and on the establishment of additional evenly distributed national identification card registration collector centers in Tharaka Nithi by the government. Honorable Speaker, the National Registration Bureau has operationalized national identity card registration centers in all 10 sub-counties in Tharaka Nithi County: Kamangombe, Tharaka West, Chuka North, Tharaka South, Mukodhima, Mara, Mudambi, Tharaka North, Chiakanga, and Chuka South. In addition, residents can access services in 17 divisional centers across the county, as well as 4 Huduma centers in Kadwana, Chuka, Marimanti, and Mara, where National Registration Bureau has established registration centers. At the national level, NRB has established 934 registration centers from regional to divisional level, ensuring broad coverage and inclusivity. This extensive network ensures that registration services are accessible to all Kenyans, supporting inclusive and socio-economic development. The ministry continues to operationalize newly created administrative units, which plans to incorporate NRB and civil registration officers into the designs of upcoming DCC and SEC officers, which will further expand registration services to all divisions. Mr. Speaker, just allow me 1 minute to emphasize one thing. One, because I've seen some propaganda out there about identity cards. All the identity cards that have all the people who have picked the identity cards, we have printed all the identity cards except 58,000. And those 58,000 will be printed before Friday. And will be sent to all centers across the country. There are no pending printing of ID cards in the country except the 58,000. And at the rate at which we print ID cards, by Friday will be done. That shows the highest level of efficiency since independence in terms of printing of ID cards. Number 2, Mr. Speaker, the region where Senator Mwenda comes from, Mofire, my friend, has the highest number of centers of registration in the Republic, led by counties like Kiambu, Nyeri, Kirinyaga, Embu, the entire part of central region, and the 3 counties in the eastern region. In fact, those plus Nairobi and a few counties like Uasin Gishu, maybe Kericho, Kisumu. Those are the counties we can say they have the highest numbers of registration centers in the Republic. There is no reason why a Kenyan should not have an ID in any part of Central Province, Nairobi, parts of Central Rift, the most marginalized areas historically, and I must say this, Mr. Speaker, is the Coast region, the Northeastern region, the North Rift parts of West Pokot, Turkana, Baringo, Samburu, the Upper Eastern of Isiolo, Marsabit, and, Mr. Speaker, the other parts of the country like Busia, the border there. Those are areas they can complain about ID cards. For the information of all the propagandists, these areas that you are purportedly saying they don't have IDs, there is absolutely no reason. If there is a reason why someone doesn't have an ID, it is personal reasons, because the access to services. But a person in Wajir, even when we have taken the registration center to a constituency, is still comparative to other parts of the country, Central Rift, Central Region, and so forth, that person is still traveling compared to that more than 3 counties in one constituency. And so the people who should be complaining about access of IDs is not somebody who is in Nairobi and its environs. It is the people who are in the far-flung areas, whom now are being accused of being assisted by the government, and yet we haven't even operationalized more administrative units for them to get IDs. This issue, and I must caution us as political leaders, let us not take our tribal bigotry to the level of hating parts of the country, people to get services. People need ID to access SHA and other basic services. I would understand if someone complains in Kilifi, But somebody who will complain in Nairobi here or Eldoret or Nakuru or Kericho is actually unacceptable. Those people should be able to go and get their IDs. We have enough centers across the country. On deployment of mobile registration, I must say, Mr. Speaker, that recognize that access to identification documents is a fundamental right. The ministry has undertaken several mobile registration initiatives to address accessibility challenges, including, Mr. Speaker, during our Duale Usalama engagement, during these forums, NRB conducted mobile registrations in all the countries where we went using live capture technology, reducing turnaround time for national ID issuance from 30 days to 7 days. School-based registration in partnership with Ministry of Education, NRB registered over 33,000 eligible students aged 18 during the second and third school terms. This program will continue in these years across the country. Usajili mashinani. Our ministry launched in Usajili Mashinani in October 2025. This mobile registration initiative targets marginalized and nasal counties, bringing services closer to communities with poor infrastructure. Expansion of the program is ongoing to ensure equitable access. At the moment, this team is in Marsabit and Isiolo, and hopefully they will go to the 3 counties of Northeastern next week. These mobile registration exercises have significantly improved access to national identity cards and related essential services, reinforcing the government commitment to inclusivity and citizen-centered delivery. Last, Mr. Speaker, which is 23, a question of Senate Minority Leader, Senator Matsayo. I wish to state as follows. Regarding the ministry current strategy of maritime security, Honorable Speaker, maritime security remains a key national priority due to its critical role in supporting Kenya's economy, safeguarding national security, promoting the blue economy, and ensuring regional stability. Kenya's coastline border major international shipping routes and the port of Mombasa handles a significant proportion of the country's international trade, including transit cargo for neighboring and land-linked countries. The ministry, through the Kenya Coast Guard Service, has adopted multifaceted strategy to enhance maritime security, including enhanced maritime surveillance, community engagement and initiatives, including Usalama Baharini, which is part of this concept of engaging the stakeholders. 3, interagency coordination, a joint operational framework by KDF, police, and so forth. Regional and international cooperation, including joint patrols and intelligence sharing with neighboring countries. With the National Maritime Risk Framework, Kilifi County is classified as medium risk area. While it's not a high threat zone, factors such as high small vessel activity, numerous landing sites, and its proximity to areas previously affected by cross-border security concerns necessitate sustained monitoring and security presence. On the reasons why Kilifi County, despite its long coastline and strategic position, has not been prioritized for deployment of Coast Guard, Mr. Speaker, the Kenya Coast Guard Service already maintains an operational presence in Kilifi County, specifically in Ngomeni Station, which supports maritime security operations within the area. This presence is reinforced by operational support from Mombasa Station and offshore patrol capabilities. The ministry has plans to expand this presence through the establishment of additional stations in Mayungu and Kilifi Town. However, implementation has faced challenges, including limited availability of suitable public land, high cost of acquiring private land, and budgetary constraints affecting infrastructure development. Despite these challenges, Kilifi remains a strategically important area, and efforts to enhance the deployment of the county are ongoing. Regarding the status report on capacity and distribution of Kenya Coast Guard's assets, the Kenya Coast Guard maintains a strategic operational footprint along Kenya coastline, anchored by stations in key locations and supported by patrol vessels and surveillance systems. Plans are underway to expand coverage through additional stations and improve the infrastructure, subject to the availability of resources. The allocation of assets and personnel is guided by the following criteria: operational necessity, strategic positioning, resource optimization, stakeholder engagement, ensuring there is a coordination with the local community. On immediate and long-term measures that the ministry is putting in place to ensure equitable deployment of maritime security infrastructure personnel across the coastal counties, Honorable Speaker, the Ministry ensures equitable deployment of maritime security infrastructure and personnel through the application of need-based, risk-informed allocation framework. As earlier indicated, the deployment of assets and personnel by the Kenya Coast Guard Service is guided by operational necessity, strategic positioning, resource optimization, and stakeholder engagement. These criteria are applied uniformly across coastal counties to ensure that no region is disadvantaged, while at the same time prioritizing areas with higher security risks and operational demands. In addition, ongoing engagement with the National Treasury is aimed at securing necessary resources for recruitment and deployment of personnel to ensure balanced coverage along the entire coastline. These measures are designed to guarantee that maritime security are distributed, security services are distributed fairly while remaining responsive to evolving security needs. These interventions are aimed at strengthening maritime governance, enhancing national security, and ensuring that all coastal counties benefit equitably from maritime security infrastructure and services. I thank you, Mr. Speaker.
Cabinet Secretary, there is one question. I don't know if you have it in your list. Number 52, asked by Senator Hamida. It was answered. My apologies, Senator. I think we deferred it. Cabinet Secretary, I'm still calling you Senator, but
That's okay.
I think that question was deferred. We will go to supplementary questions. Senator, could I ask the senators who've asked the questions to give an opportunity to the senators who've not asked a question so that they can ask, maybe it's a, yes, they will ask a supplementary based on your question, if we can give them an opportunity because they have not spoken. Senator Kisang.
Thank you, Honorable Speaker. Honorable Speaker, mine is quick, is to thank the CS because I attended the Chukua La Usalama in Elgeyo-Marakwet County and it bear fruits. Now we have peace in Elgeyo-Marakwet County. My supplementary question is, what plans does the CS have to prefer charges against those who self-abducted themselves, but in the process, actually, we have come to discover they were doing self-enjoyment?
Senator Miraj.
Asante, niweze kumpongeza waziri kwa kutimiza nusu ya zile ahadi aliweka wakati alikuja katika jukwaa wazi pale Mombasa. Na pia ni muombe katika swali langu, kuna mikakati gani kuona ya kwamba kando na kuwa tunapeana na kusajili vitambulisho katika shule zetu, tunawezaje pia kusajili birth certificate, kwa sababu watoto wingi hususan wale wanaotokea maeneo ya Likoni wanakosa ile huduma ya capitation kutoka kwa serikali kwa sababu hawatambuliki na serikali. Naomba kwa unyenyekevu uweze kutupatia mwelekeo. Asante.
Senator Veronica.
Thank you, Honorable Speaker, for the chance. I will ask this question as a supplementary to the missing persons records that have been called forth by Senator Manzo. To Honorable CS, there are Kenyans who were tricked to go to war in Russia, and they eventually found themselves at the battlefront between Russia and Ukraine. And there is one gentleman, James Mushoki Mwangi, from Kegumo constituency, I believe Muthithi, who the family has lost contact with. What are you doing to ensure that such Kenyans are restored back to their families? And do you have any plan to ensure their safety while they are out there and their protection by the government that they are serving under?
Honorable Senators, we have 3 minutes. If you allow, let's give an opportunity to the CS to answer those 3 questions. And if we still have time, we'll take one more question. We don't have time, Senator Nyuto. Senator Nyuto, you did even ask a question previously. So I was giving an opportunity. You're right, but she's a speaker. She's a speaker. She's a speaker. So, Senator Lelengo, let's allow the CS to answer. CS, let's... Okay, very quickly. and then you two very quickly. Very quickly, we don't have time.
Thank you, Mr. Speaker. On registration of new IDs, we commend the government for extending mobile ID registrations to sub-locations, particularly in Samburu County. However, the turnout has been overwhelmingly high, with many citizens unable to register and officers
ask the question,
work
Senator.
beyond official hours. Could the Cabinet Secretary consider extending the registration
Thank you, Senator.
period in Samburu and other marginalized areas?
Thank you, Senator. Senator Newto, very quickly.
Thank you, Mr. Speaker. It's unfortunate we cannot raise a standing order, against CS. But, Mr. Speaker, we must tell the CS that I was there with Rigathi Gachagua at Karen Hospital.
Do you have
and
a question?
we were given...
Do you have a question?
Yes, and we were
Quickly.
given a brief by the doctor. So, Mr. Speaker, it's not...
Yeah, thank you, Mr. Speaker. On the question of Senator Kisang, Senator Kisang has asked the question of why we have not charged these people. As you know, Mr. Speaker, former Minister Tuju was charged. As you know, Mr. Speaker, Honorable Koimburi obtained a court order, and Justice Mita also protected a young blogger who was supposed to be charged. So this is an ongoing process, and I thank you, Mr. Speaker.
Thank you. Thank you, Cabinet Secretary. Because of time, I would ask the senators who still have questions, maybe you can approach his office and pose the question to him at his office. Thank you, Cabinet Secretary. Honorable Senators, it is now 1:15 p.m. and having concluded the business for which I extended the hours of sitting, pursuant to Standing Order 34-2A, the Senate stands adjourned until later today, Wednesday, 22nd April 2026 at 2:30 p.m.
I think the time had come to an end.
Thanks for joining.